think he's peeled off. Well, maybe he's going to be a while. Right, good morning, everyone. Welcome to this meeting of the Public Health and Communities Committee. Welcome to fellow councillors and to officers and to everyone who's joined us in the public gallery today. And also welcome to anybody who's watching live at the moment as we are being webcast, or to anyone who's watching in retrospect. For those of us who are physically present, I'll just give the normal safety announcements. If you hear a fire alarm, please proceed back out into the lobby, out of the front door, down the ramp and down to the cathedral for assembly. Unusually, for committees, we do expect a fire alarm to sound, because at 10 o'clock every Friday there is a brief test of the system. So for those of you in the public gallery in particular, don't be surprised if you hear a loud bell or sound at 10 o'clock. There's no need to leave at that point. If it continues, then it is for real. Right, if we do some introductions of members first. I'm Stephen Williams. I'm the Liberal Democrat councillor for Westbury-on-Trim and Henleas, and I'm the chair of this committee. And if I go around my political colleagues, first of all, who can introduce themselves and say at this point if they're substituting for somebody else as well.
Thank you, Chair. I'm Patrick McAllister, councillor for Hotwells and Harbourside, and I'm substituting for Councillor Fee Hans today.
I'm Cara Levan, councillor for St George Central.
I'm Abdul Malik. I'm councillor for Ashley Ward.
Ed Fraser, Green Councillor for Eastville Ward.
Podolodin, councillor Hanbury Braintree.
Carol Johnson, councillor for Hallfield Ward.
Tom Leggetop, Labour councillor for Avonmouth and Lawrence Weston, substituting for Vice Chair Emily Clark.
Lisa Durston, councillor for Philwood Ward.
Right, and joining me throughout the meeting to my left is Ian Hurd, who's our Democratic Services Officer, clerk to the committee for today. And we've got various other chief officers from the council with us, and I'll introduce, and they can introduce themselves as we go through the papers. Are there any, we've dealt with apologies for absence and substitutions via the introductions. Do any members have any declarations of interest relevant to our meeting today? Cara.
I've made a film in the past for Talking Money, who are an advice facility. I mean, they weren't my direct client, but they were the end result of the people I was making the film about. It was one day's work.
Thank you. Patrick.
Thank you. I'll just flag that in my day job I do work with some advice agencies, including Talking Money, but that shouldn't prejudice my discussions today.
Thank you very much. If we go on to agenda item 4, which are the minutes of the previous meeting, I've gone through them and they appear to be a correct record to me, so I'd like to propose that we accept them as a correct record of our last meeting. Can I have a seconder, please? Councillor Fraser, thank you. So they are accepted as a correct record. Agenda item 5, Chair's announcement. Don't have anything particularly heavy to say. We've got 6 items to consider today, which reflect the broad spectrum of responsibilities of this committee. One of the items, agenda item 9, is the Healthy Weight Declaration, the Y Weight Declaration, which we are making on behalf of the Council. We're going to take a photograph after that, and at that point we're going to have a break in our proceedings for us to do that. Items 11 and 12 are setting up 2 task and finish groups on important areas to the committee's work, on commercial opportunities for our parks service and for our events team. and we're also setting up a strategy working group for the library service. And I'll say this again when we come to it, it's important to understand from the outset that that group is designing a strategy for what we want the library service to look like. It is absolutely not a decision-making forum for any closures or budget reductions or indeed enhancements. That will come after that group has reported in November. That would be the point where officers draw up how they think the committee's recommendations could be implemented, and it'll be at that point where we may or may not have some difficult decisions to make, but we can come back to that when we come to agenda item 12. Right, we can turn now to agenda item 6, which is the public forum. We have 30 minutes available for us on this, and there are a number of questions and statements in front of us. And we're going to take questions first, and as I work my way through them, if the person who's asked the question could indicate whether you are here, and if you are, you can ask a maximum of 2 supplementary questions to the answer that's already been provided. In each case, the written answer prepared by officers should have been shared with the person who submitted the question, but they are being displayed on the screen for people to see as well as we work our way through them. Right, the first question is from Kate Spreadbury from the Bristol Parks Forum Committee on area committees and the Community Infrastructure Levy Equity Fund. Kate, are you here? She's not here, but the answer to the question will be published. Question 2 was also from Kate. Question 3, we could be quick on this, was also from Kate, so we can work our way through those. Question 4, though, is from Francis Robertson, who I think is here, also representing the Bristol Parks Forum. Francis, do you have a supplementary to the one-word answer to your question? Right. Thank you, Francis. Question 5 is also you, Francis, again on the tree planting programme. Do you have a supplementary to that? That's fine. Most of us know Len is chair of the Parks Forum, so ask away, Len.
Sure. What has caused the reluctance that I perceive in the answer to link this work to local nature recovery plans when the work could contribute positively to aspects of those recovery plans? That's the question.
The general rule here is I try at least to answer the question when it comes from the gallery. I think we'll be flexible in what we do with the materials that are left, either in situ or taken away. I guess it depends on the setting in some cases, and whether alternative use might be found for the wood. But I'm going to turn for inspiration to Mr. Fletcher, who's our head of Park Service, and if his mic's working, he can bail me out, or if he can get to a microphone.
No reluctance, Len, particularly, but Councillor Williams is correct that it all depends on the locality, really, as to whether we're going to leave timber. It's obvious that in some spaces, for example, there's quite a lot of ash trees that may need to be removed. What does that look like in terms of leaving timber behind? It can be really important for habitat, as you know and we know, and if we think it will be important for habitat, we'll definitely be leaving it behind. The whole programme will be supported by Nature Conservation Officer plus additional ecological support, which we will purchase in through the funds that we have.
Thanks, Richard. You can have a second supplementary if you like, Len.
Thank you for the explanations. The second question is it possible to change the response just to make a conditional link to contributing to local nature recovery plans?
Well, the combination of the answers you got from me and from Richard will be noted and in our minutes. So I think we'll probably deal with it that way. That's okay. Right. Question 7 is actually from Len Wyatt on the Task and Finish group on commercialisation opportunities in our parks, estates and events. And you're indicating you don't have a supplementary. Thank you very much. Right, in that case, we'll move, we've gone through all the questions, we'll go on to statements, and I know whether you're doing a double act here, Len and Francis, but you've got a statement, which we have in front of us, but you're quite at liberty to read it out or summarise it, as we've got plenty of time.
Thank you, Chair. I shan't be reading it out, because I'm sure you've all had an opportunity to read the statement, which has some detail. But what I wanted to flag up is that it's key to Bristol's parks and green spaces that all of them need funding, not just for maintenance, but also for improvements. However, not all are suitable for commercial activities, but the income from any commercial activities must be used across the whole of the parks estate and not just where income is derived. Bristol Parks Forum would welcome the opportunity to be involved with the Task and Finish group, as our members have a wealth of knowledge of the sites, their individual spirit of place, which of course is very important. Not all parks that are similar are the same. And we've also been involved in a number of previous initiatives when successive administrations have been looking at various commercial opportunities, and we'd like to bring our expertise and knowledge to the table. Thank you.
Thank you, Francis. And while don't usually respond to statements in these sessions, I can give that assurance that both Task and Finish groups, in fact, as well as being a safe space for councillors to have robust conversations, if we need to, between ourselves, there will also be an open opportunity for various groups. This applies to both the Libraries group and the Parks Commercials group to hear evidence, if you like, from interested parties, and we'll set that out once we've passed the papers that are in front of us. In due course, over the summer, we'll set out what the opportunities will be for people to engage with both of those groups. Okay, so that... oh, there's one more statement, sorry. Turn over the page. From John Shoesmith on behalf of the Bristol Advice Partnership. John, are you here?
Yes.
You are. Sorry, we've met before. If you'd like to make your statement.
Yes, thanks very much, Councillor Williams. So we've made this statement on behalf of the seven current members of the Bristol Advice Partnership. We thoroughly support the Council's decision to continue this investment in the advice sector and indeed its other investments in advice. And we're very grateful for the contact and the interaction we've had leading up to the opportunity ahead. We'd particularly echo these principles in the funding plan, namely a comprehensive specialist advice offer focused on certain advice areas that we see particularly prevalent: benefits, debt, housing, certainly immigration. Secondly, you mentioned the principle of a geographical community-based advice output, and we really support that. And you also made specific mention of bilingual advice services and the importance of accessibility for the rich and diverse community we've got. Our statement then went on to list some key evidence of the community's advice needs, which I won't read out because they're quite granular and you've got them in your papers, other than to say that we are seeing more and more demand, and looking back on now quite a long period of time that you might track back to the global financial crash, followed by a pandemic, and then the cost of living crisis, and now, amongst other things, some forthcoming quite radical changes to disability benefit. It's objective to say that the community's never needed the advice sector more than it does now. So I say that really just to echo our support that you're continuing to be there. We then go on to describe some of our key offers to the community, but again, I won't itemise those because you've got those in the pack. And we just wanted to say that we are collaborating and liaising with the advice sector as a whole as we prepare to work out how best to articulate our offer and that's the stage we're at now. We're very much looking forward to applying.
Thanks for your statement, John, on behalf of the current consortium of advice agencies. And as you say, there's a lot of useful facts in your statements, and a lot of those are in the report, which we are coming to right now. So if we move on to agenda item 7, this is our approach to funding the various advice agencies around the city. And we're seeking authority to invite voluntary community and social enterprise organisations to apply for the advice grant, which will invest £2,240,000 in grant funding over 4 years. That's £560,000 per annum from April 2026 to 31st March 2030, with an option to extend it for a further 12 months. The advice grant invests in the advice sector to deliver high-quality advice services, strengthening the resilience of Bristol's citizens and communities. This is coming to the committee because it's a key decision with a value of over £500,000. And to put it in context of what we're doing, here we are opening the process for people to apply for this funding, which cover a variety of needs in the city, as we've just heard in the statement. There's never not a need for advice because it's a very dynamic situation in terms of household finances, but also across the spectrum of advice that our city's citizens need. Could be everything from immigration and asylum support from an organisation such as the Law Centre, through to consumer advice, to dealing with your landlord, and so on. So there's a huge range of advice available to the people of Bristol that are supported by these organisations and underpinned by the significant investment that we're putting on the table. But before the committee goes into a discussion, I'd like to invite Penny German, who's the Head of Service for Communities, to give the professional introduction to the report.
Thank you very much, Chair. Good morning, everyone. So Bristol is very fortunate to have a mature network of localised and citywide advice agencies, which are an important part of the city infrastructure, providing support and services to thousands of people each year. And this has evolved over decades. Free access to advice is a key frontline support service for people experiencing poverty, debt, and many other forms of hardship. Poverty is both a symptom and a cause of other forms of inequity experienced by working class communities, disabled people, black and racially minoritized communities, women, and others. The City Council currently invests £560,000 a year in the advice partnership of 7 organisations which form the Bristol Advice Partnership. And this grant arrangement ends on the 31st of March 2026. So together they offer a wide range of regulated advice support. The benefits of investing in advice are clear. On a practical level, it enables people to maintain well-being, housing, employment, which in turn contributes to healthier and more resilient communities. In addition, the Citizens Advice Bristol estimates that for every £1 that we invest, the public services save £2 on services that are not otherwise needed. And there's a wider economic benefit from about £14.69 in increased productivity, well-being and participation in community life. So in 2024, the Bristol Advice Partnership carried out a needs assessment which shows the scale of the financial and social challenge in Bristol. And the VCSE advice strategy, so the Voluntary Community Social Enterprise Sector Advice Strategy, has been developed to respond to this. The council grant investment will contribute to the delivery of the strategy, in particular, equitable access to high-quality advice in local communities, better collaboration with community organisations, improved referral pathways, ensuring timely support. Following engagement with the sector, we are not proposing any significant change to our current approach, and that's set out in Appendix A. Applicants will be invited from VCSE organisations with a track record and depth of experience in Bristol. They will be expected to build on and maximise assets within communities and those of city partners. Applicants will be expected to hold a recognised advice quality standard and be able to meet the City Council's baseline standards. We are also seeking an option to extend the funding agreement by a further 12 months. Thank you very much.
Thank you, Penny. Open it up to members of the committee. Do people have any points to make? So I've got Lisa, then I'll take Cara, then Tom, then Abdul. So Lisa, you go first.
Thanks very much, Penny. I've got a couple of questions. The first one is around there's recognition in the advice strategy that there's a difference in kind of equity of access to some of these services, and that South Bristol in particular doesn't have the same array of services that's maybe available in other parts of the city. Thinking in Philwood particularly, the South Bristol Advice Centre doesn't provide advice on immigration or housing. I know there are other services within Philwood that do provide housing advice, but particularly around immigration, where would somebody within South Bristol go to seek that kind of advice? Shall I ask the other one as well? I think I've rolled them all into one, actually. So, yeah.
Okay, so there's a local but also a city-wide service. So wherever you are in the city, you will be able to access services. Whether you can't drop in, they're not kind of next door, but there are access to services for everyone across the city. In terms of the future, through a grant process, we're saying advice agencies, you're the experts in the delivery of services, put forward your grant proposals and then we review them, and access to services and equity of access to services is certainly something that we will be looking at as we assess those applications.
Thanks, Lisa. And you mentioned immigration advice. I mean, I would always say, as someone who also used to work in this area and wearing a different hat, that if it's an emergency, people should go to their member of parliament, particularly if they're at risk of removal or deportation, because they can stop it far faster than an agency. Right, so I've got Cara next.
It's really valuable service, and it's great that the city can continue to support this service, but the voluntary sector is facing huge challenges, as you very well know, and this grant is in real terms isn't as big as the sector needs. So I wonder if it will be possible for the sector within the when the grants are awarded to have scope to apply for further funding, so that the funding that we grant them isn't just KPIs and targets for numbers of people seen, but also that there's scope for voluntary services to actually be able to pay to get further funding from central government. Does that make sense?
Yeah, if I've understood correctly, so the City Council's funding is a contribution.
Yeah.
And obviously the budget envelope is the budget envelope. The organisations all do an incredible job of levering in a huge amount of money to the city, and they work incredibly hard to make that happen, and we all appreciate that it's very difficult times. I'm not sure what else you would like us to be doing, or you think we could be doing. Yeah.
When the grants are allocated. Did you get a prize for being the one in the back speaking? when the grants are allocated, is there scope within for organisations to decide how they're spending that funding? So can they spend funding on seeking further grants from central government as needed, or is it strictly KPI related to the number of people seen? And also, given that in real terms the grant is actually smaller than it would have been 4 years ago, will that be taken into account?
I understand, yes, thank you. So yes, that will be taken into account. We understand that it's a standstill budget, and it's really core funding, so it's enabling organisations to exist and to do the things that they do. KPIs are part of that, but yes, it's about giving that capacity to organisations to do the other thing, to exist and to provide a service to Bristol. Yeah.
All right, Councillor Blenkinsop.
Yeah. So I'll echo some statements already made that this is really, truly immensely valuable work, and I've only grown to appreciate how much the advice sector does as I've been a councillor. I was just curious, it's a small question. We've got the focusing on the provision of the 5 main types of advice: housing, debt, welfare, employment and immigration. Are we directing grants roughly in equal proportion to those, or is there one we're weighting slightly higher than the others, or how is that being split up in terms of the grant funding model?
So we don't split it up in that regard. So what we say is that the advice sector are the experts in this. They understand, they've done a needs assessment, they understand where the demands are, and what we're looking for is a proposal that seeks to meet the demand as far as they can within the resources that are available. So they would weight where they think the funding needs to go, and we would assess that. Yeah, but yeah.
Okay, thank you.
I guess, though, we need to look for organisations that have the capacity to be flexible as well, because as John from the Citizens Advice Bureau said, in public forum, things are constantly changing. Legislation changes, budgets change things. So I guess we're looking for organisations that are adaptable as well.
Yes.
Councillor Malik.
Thank you, Chair. And really, my points have been addressed. Lisa and Cara touched on what I was going to talk about. But first of all, really support this. Obviously, this is a lifeline for a lot of people in my ward. The recent transition of the St Paul's Advice Service to the Junction 3 Library kind of collates two things that we're going to be talking about today, but also gives the opportunity for St Paul's Advice Service to be in a better position in terms of the building that houses it, but also that the people that would be using that service and being right there at Junction 3 is going to be absolutely amazing for the community. So a really welcome move for that particular service, and obviously this grant unlocks lots of other opportunities for people that are part of this core funding. And so I just wanted to say that I think it's really important that we make sure that these services are supported, and also that we're taking note of the people that are using them and how different that is year on year. One of the things that I'm always going to say is that the engagement with the people that respond to these surveys in terms of the quality of service that we're receiving, I think we have to do a little bit of more work on that, try to engage with more people, make sure that we're able to encapsulate the whole picture. It doesn't seem to be as many numbers as you would expect for such a big grant.
Thanks, Abdul. I think those statements don't need a response. Are there any other points from committee members? In that case, we'll go to the recommendations, which are that the Committee for Public Health and Community authorise the Director for Adults and Communities and the Director for Public Health, in consultation with the Chair of the Public Health and Communities Committee, to take all steps required to award the grants in line with the maximum budget envelopes for up to 5 years as outlined in this report. And thirdly, to invite applications for the advice grant of £560,000 per annum, a total of £2,240,000 over 4 years, from 1st of April 2026 to 31st March 2030, in line with this funding approach as set out in this report, and to extend the funding agreement by a further 12 months if we need to, making the total programme 5 years to 31st March 2031 at an additional cost of 560,000. So those are the recommendations which I move. Can I have a seconder, please? Councillor Blenkinsop, thank you. Could all those who are in favour of the recommendations please indicate? That is unanimous, so thank you very much. Right, we'll now come to agenda item 8, and we're keeping the same chief officers with us for this. This is an update on the re-establishment of the area committees, which is something that the new council has done. Various people will remember the iterations in the past of different area committees or neighbourhood partnerships, various attempts by successive administrations to devolve to a greater or lesser extent some decision making and some budgets to community levels, but of course not in the same meaningful way as all of our neighbours are used to, where they have town and parish councils, which maybe is something that we will consider at some point in the future, whether there could be urban community councils, but that's a debate for another day. But we are reconstituting area committees, 9 of them across the city. Some of them have already had, 3 of them have already had their first meeting, and 6, including my own area committee too, will be meeting over the next few weeks. The funding for these area committees, I'm just saying this for explanation for people who are watching or listening, comes from a proportion of community infrastructure levy, which is the tariff that the city levies on significant developments around the city. 85% of that tariff is retained centrally to spend on strategic projects, which are mostly transport, but 15% is devolved to the area committee and would be devolved to a parish council in our neighbouring authorities. And it's that budget that the area committees have to spend according to local priorities decided by the local ward councillors in consultation with their residents. What is new this time round, that is quite common right across the country, what is new in Bristol is a decision by the last council, when it was deciding how this new committee system would work, to set up a citywide equity fund, which top slices some of that 15% community infrastructure levy that is devolved to area committees. And that equity fund, those bids are being put together at the moment, and they will come to this committee to decide the final awards later this year. So this report sets out that background and context. And before we widen it out to the committee, Penny, it's your turn again to give the professional introduction to this report.
Thank you. So this report covers 2 things. There's 2 parts to the report. One is the update, to update the committee on the work relating to the implementation of the new terms of reference, and to seek approval of the criterion process for the new local equity fund. So the committee will be aware, as the chair's just described, about the full new terms of reference for area committees that was agreed by full council, which established 9 committees, the new fund, and also gave a number of functions, new functions which are set out in Appendix A 1.1. The SIL Equity Fund is created from allocating 15% of the local devolved community infrastructure levy for this purpose. Currently, there's £173,000 in the pot, and this is likely to increase as the year goes on. It's important to clarify that this excludes 25%, which must be allocated to areas which have a neighbourhood development plan. The proposed criteria allocation and decision process for the equity fund is set out in Appendix 2. These proposals have been developed with area committee chairs and take account of existing processes and available resources. So in summary, the area committees will prioritise proposals for the SIL Equity Fund which meet the criteria at the summer meetings which the Chair's just referred to. And proposals must be in areas of greatest deprivation and or led by equalities groups. Area committees are advised to limit the number of proposals taking account of the budget available. The area committees' priority projects will be invited to work up full proposals which can be technically assessed by officers and considered by the Public Health and Communities Committee at its November meeting. Progress to date and the proposed way forward in terms of the new functions are set out in Appendix A 1.1, and the forward plan includes a refresh of the current guidance for devolved SIL, which we propose to bring to the committee in November for consideration. Thank you.
Thank you, Penny. Are there any contributions from members? Councillor Fraser.
Thanks very much, Chair, and thank you very much, Penny, for that introduction. While I'm on the topic of thank yous, I wanted to thank Ellie Stevens, who's here in the chamber today, Julia Follino and latterly Charlotte McDermott for their work in setting things up with the 9 of us Area Committee chairs. So I'm the chair of Area Committee 5, covering the northeast of the city. We're really grateful. I'm really grateful that this new facility now exists, and that we've had the opportunity as a committee and as Area Committee chairs to bring this forward as quickly as we possibly could, so we can get this equity fund up and running this calendar year. And that's going to be particularly of benefit to those area committees that have less access to funding. So thinking of St George's, where specifically there are 2 lower super output areas, which are the areas which are eligible, around the Summerhill Road Junction and Speedwell Road. So very clean that they have an opportunity to put forward bids as well where their funding is limited. There's quite a lot of technical language involved in the criteria, so I wondered, just for the benefit of everyone here in the gallery, if I don't know if this is for you, Ellie, or for someone else, to clarify what an LSOA, a lower super output area, is, and why this is the measure used to measure levels of deprivation within the city.
Okay, either Penny or Ellie, which one of you want to take that? And thank you also for saying thank you to the officers, which we should do more often, perhaps, but a lot of work has gone on in the background preparing councillors for these new responsibilities, in particular those like yourself, Ed, who are chairs of area committees. Which one of you wants to take that census explanation?
Well, I'll start, and then so a lower super output area is a national thing that where we measure, where we understand deprivation across the country. A lower super output area is a small area, so sub-ward. Wards are broken up into lower super output area, and I think there's a map in here of those lower super output areas. So they can be really quite small areas where there's a standardized measure of deprivation. That's what we're referring to in this SIL Equity Fund.
That's great, thank you. That matches what I felt my understanding was, so that's great. The other question I had, just around the criteria that's in Appendix 2 of these papers. So the first criteria is around the lower super output areas. The second criteria is based on what funding allocations have taken place in the previous 2 calendar years. And it'd be really helpful if we can just confirm now that that stipulation number 2, so that's prioritising the 25% of wards that have had the lowest allocations in the previous 2 years, just to confirm that stipulation is advisory and not compulsory. The reason I say that is because there could well be a perfectly good project in a deprived area that we might not want to see refused purely on those grounds, say because they happen to have a park bench 18 months ago. So it'd be really good just to clarify that.
Yeah, you're right that it's, is this working? Yeah, you're right that that's an advisory criteria, so it's there to kind of aid the deliberation and help to narrow things down when that's needed, if there's more proposals put forward than can be funded. Just the only clarification I'd make is that the 25% that's about, it's areas that have received the 25% lowest amount of SIL, rather than the 25% of wards, if you see what I mean. So it's to do with the amount of money and the threshold of the money rather than the number of wards. Does that help?
Yeah, that's a helpful clarification. Thank you very much, Ellie and Penny.
Thank you. Yeah, and on the lower super output areas, genealogy is one of the hobbies I don't have much time for. They used to be called census enumeration districts, which I think is much clearer, but that's often the way. Any other observations from the committee? Patrick?
Thank you, Chair. I would like to echo Councillor Fraser's praise for the officers. As the Chair of Area Committee 3, it was great to be in those meet chairs briefings and sort of see the process taking shape, and clear a lot of hard work did go into this. I did have a question passed up to me from some of my Area Committee members who were wondering why the Equity Fund wasn't being allocated from strategic still. Obviously, tackling deprivation is a strategic project across the city, and it's a much larger pot. So I was wondering if I could get an answer to that on the in the meeting record, please.
That is a very good question, something I've asked myself throughout this process.
So it's a decision that was taken by members, so it's not not something I can comment on.
I think it's fair to say it was taken by members under the previous council, not this one.
It came from the working group, the committee working group, and then was a decision made by full council.
Yeah, so we're implementing something that the committee working group of the last council set up. That, of course, does mean if we find this process as we work through it becomes, I don't know, too bureaucratic, or some of the principles aren't right, that we can't bring it back to this committee and maybe full council if we need to, but we can take advice on that to amend it in future. But I see this as a journey. We're just starting the process today. I certainly believe in more devolved decision making to the lowest possible level, and I'd like to see these area committees take on more responsibilities and, if possible, more budget as well. But certainly I think this is a dynamic process, not a fixed one.
Thank you, Chair. Yes, I do. And thank you for that response. One of the impressions I've had from the Chair's briefings has been that there's a lot of really good ideas that everyone really wants to support, but sometimes the implementation we felt has needed a bit of tweaking. I'm thinking particularly around some of the collaborative proposals to work with Bristol Waste on graffiti removal and waste and management and so on, with when funds are only allocated once a year from area committees and there's quite a long lead-in time. So I was just wondering if there was a breakdown, if we could maybe get a breakdown of changes that have been made as a result of those briefings with chairs, or changes that are maybe planned for those proposals. Obviously, there's been, I know what changes there are from the chair's briefings, but I may have been mistaken, but I don't think I saw those in the papers. I think it would be really useful to have that list of how the processes have been altered as a result of feedback from the area committees and the chairs.
Are you, just to clarify, are you talking about the guidance that we use for devolved sales schemes and the changes to that?
Yes, effectively, and then just the broader terms of reference, although I appreciate that's a somewhat separate matter.
Yeah, so we're reviewing the terms of the guidance, in terms of the projects, how to develop a devolved sale project. So that will come in November. I think the work of the area committee group is about those kind of back office systems and ways of working, as opposed to you're not changing the terms of reference. You're kind of working out how to implement the terms of reference. And very happy to put those things in a report. We did try and provide a summary of everything that's happened from the beginning to now, but have I understood your question?
Yes, thank you. That would be very helpful, and minor apology for the word salad earlier.
Thank you.
Tom?
So I'd like to start by echoing what's already been said. It's been fantastic work from the officers, and again, commend them for all the hard work they've put on this. I'd also gently like to note, Stephen, that the committee working group was made up of all parties. That was not just a last administration decision, just to make that very clear.
I think I said previous council, not administration.
Fair enough. All right, I take the point on that. But I did have this, and I will say off the bat, this is not a concern from my end. We did not get much in the way of the equity fund, but I was talking to a couple of other Labour colleagues and expressed slight concerns about the engagement that had been with some of the prioritisation or changes that might need to be made. So, if there's, say, 2 or 3 proposals that relate to transport, highways, or something along those lines, I would worry that, councillors may need advice on how we would rank those, what they might deliver for the area in the city. So with that in mind, have we got anything in place to make sure that councillors who do have equity fund questionings, or across the area committees as a whole, I guess, if they've got concerns about what to prioritise and what will work best, do we have a mechanism that can help them make sure that officers can give them a bit of a steer on that?
Ellie?
Yeah, I guess my response would just be the first port of call would be to contact our team, so the communities team, and I think most people should be aware of the email address to do that. And then where it was a kind of conversation that was needed with other colleagues, so transport colleagues or parks colleagues or anyone with that kind of technical insight, we would put you in touch with the relevant people around prioritisation. What we do already do is where there are teams who can provide technical insight, they set up surgeries that councillors are invited to come along to discuss their proposals before the area committee meetings, so that you can kind of talk those through, get comments, etc. I know that this year that process was very tight in terms of time frame, so some people didn't have time to make those meetings, and that's obviously something that we'll try and avoid in future. But also colleagues are asked for comments as well, so you get those in writing. But if you ever need those expanded on, or you want a further conversation, please do get in touch with us. As much as possible, we're happy to help, because that kind of early conversation really helps to prevent the situation where a proposal is fully developed and then deemed unfeasible. We'd rather find those things out early on and tease out the principles earlier. So.
No, I definitely agree on that, and I recognise we're operating under some time constraints this year. It's been a difficult process at times, so again, thank you very much for persevering. But yes, it's good to know that in future, and I think we'd all like a joined up approach to when we're developing these kinds of bids through the area committees.
Yeah, thank you. If I could just add that, this year, as everyone's commented, has been, everyone's had to work really hard, everyone, to get it through, and we will be learning from the process this year and going into next year. So please do feed in your kind of comments, and we appreciate them. Thank you.
Any other observations or questions? Right, in that case, we'll go to the recommendations, which are that the Committee for Public Health and Communities 1 notes the update report about implementation of the terms of reference for area committees. Secondly, approves the criteria and process for allocation of the local community infrastructure levy equity fund to be introduced as part of the area committee process for 2025. Thirdly, notes that a paper setting out the SIL allocations for the equity fund 2025 will be brought to this committee in November, likely. And fourthly, notes that to bring revised local SIL and Section 106 planning gain funding guidance to the Public Health and Communities Committee in November to come into effect from January 2026. So I move those recommendations. Can I have a seconder, please? Councillor Fraser, thank you very much. Will all those who are in favour of the recommendations please indicate? That again is unanimous, so thank you everyone. Right, I think we're going to have a little changing of the guard to my right, my far right at this point, when we move on to agenda item 9, which is the Why Wait, pledge for creating healthier places together. Emma's name there, okay. Right, I'm joined to my right by Sally Hogg, who's one of our consultants in public health, and she has with her one of her registrars, Emily Sidebotham, who have both worked together on this report, and indeed the whole process that has led to it, because it's a partnership approach, not just in Bristol, but right across what we're supposed to call the system, which is the integrated care system, which not only covers Bristol, but also North Somerset and South Gloucestershire. And this is a pledge which today, subject to what we decide as a committee, are going to sign up to on behalf of the council. And I think we'll be the first body to do that in the area. The pledge itself has already been endorsed by the Health and Wellbeing Board for Bristol, which I chair, and has been endorsed by the Integrated Care Partnership Board that covers the 3 local authorities on which I sit for Bristol as well. But this is the formal adoption of the pledge by the City Council today. And to give the professional introduction to the report, over to you, Sally.
Thank you, Chair. Good morning, everybody. So, as Councillor Williams has said, this is the Why Wait pledge for creating healthier places together. And you might notice that we've got the Healthier Together, which is the Integrated Care System logo embedded in that. It has been co-produced by stakeholders right the way across the integrated care system, including our acute trusts, our community trust, and all 3 councils. And it really sets out the building blocks for a whole system approach to create healthier environments across the whole area. It aims to address those root causes of obesity and associated ill health. And just to put that in context, we see healthy weight in 2 parts, really. So individual weight management, of which is described in tiers. Local authorities are responsible for what is called Tier 1 and Tier 2. So prevention and early intervention. And you may remember that when we came to committee before, we were asking to move forward on commissioning a healthy weight service for individuals. And then we have Tier 3 and Tier 4, which the NHS is responsible for. And that's for people that may need some psychological support. They may need some more in-depth treatment for their obesity. And why are we so concerned about this? Because at present, about 55% of the adult population in Bristol are living with overweight or obesity. And at present, children are weighed and measured in reception and Year 6, which is a national programme. And obesity rates are not going down at all, and therefore we need to be fairly radical in our thinking, recognising that this is not just about individuals, it's about the environment that communities, families and individuals live in. So it is a leading risk factor for many of the preventable illnesses, so particularly type 2 diabetes and some of the heart conditions, just to name a couple. The disparities of obesity are very clear in where we're born, where we live and work and age, and rates of obesity are higher in our areas of deprivation and in certain populations. So this includes 44% of our Year 6 pupils who are living in our most deprived areas of Bristol are living with overweight or obesity, compared to 20% in our least deprived areas. People with black ethnicity have a greater rate of overweight and obesity, so 59.6% compared to 47.2%. And again, with disabled adults, 63.2% in Bristol compared to a city average of 47.2%. Having told you all of that, obesity is incredibly complex and multifaceted. And there are approximately 108 different causes, which just shows you where we need to go with this and the complexities around it. So if you start to put those into categories, we're thinking of food production, food consumption, societal influences, individual activity, the activity environments, and a lot of individual psychology and biology as well. And we think some of the issue of this in the past has been a simplification of obesity, just saying, well, you need to walk more or do more exercise, you need to think about your weight when you're eating, and in fact it's so much more complex than that. But we also know that weight stigma is a very serious consequence, and this whole misconception that weight is a lifestyle choice, and that has a misdirected responsibility on the individual with shame and low self-esteem, which is why we've used this trauma-informed approach to put into this model. So we acknowledge the complexity. We're using international, national evidence to help us along the way. And then just to explain the name, so Why Wait really reflects both the need to act now, as well as challenging that traditional narrative of weight as a core focus, and instead refocusing our thoughts on achieving health gains across our population and highlighting our shared responsibility for creating healthier environments rather than just individuals themselves. So everyone has access and ability to eat well, feel well, and be active. So Why Wait? The Why Wait Pledge is a key deliverable set out by Bristol, North Somerset and South Gloucestershire, the Joint Forward Plan. In Bristol, it's quite relevant because the week before the pandemic in 2020, we signed a pledge to say that we would really commit to this whole systems work. And of course, it lay dormant for 2 years. And that's where this approach now has come from. So really important for us in Bristol. We're doing a lot of work already and have been throughout this last 5 years. It includes our commitment to improve the food, drink and built environment to enable good health, ensuring that all of our communities have access to healthy, affordable and culturally appropriate food. So things like Bristol Eating Better Awards, reducing weight stigma, which my previous registrar, Emily, worked long and hard at to get it embedded into this model. And we've got people asking us from all over the country now how we're going to do this. Strengthening partnership working, because without that, we're not going anywhere, and taking a co-production approach. And Councillor Williams mentioned earlier that we are quite ambitious with this. We've started with the integrated care system. If we can get that moving forward, which we definitely will now, then next year we're hoping to look at education environments, children's centres, workplaces and so on, so that eventually we get to a place where everybody understands what our issues are and we can all work in the same direction. We will, so the pledge will have up to 3 actions that we will take on as a local authority. We might divide that up a bit, but our public health team are looking at that now. And our next steps are to we will do a whole councillor briefing. We will put some things on the source. We will have a webinar for staff, and we will go to all the EDMs as well. This is a real opportunity for us as Bristol City Council to set actions that make sense for us within the context of our place and environment and our demographic. Thank you.
Thank you very much. Sally, it's worth noting, I'm sure members have noticed this, but for anyone looking at the report as well, that the pledge itself is the appendix to the report. It's on page 128, if that helps. Now, it's worth just me reading out. It's a 10-point pledge, what the headings are. They are, because we're signing on behalf of the council today, for us to provide strategic leadership, to work in partnership, to take action, as Sally said, against weight stigma, to develop our workforce, and you mentioned the trauma-informed approach, which is a precedent in a way for what we are doing here today, that lots of organisations became signatories to that trauma-informed approach, and it does involve training and commitments by the partner organisations, and some of us, councillors, took part in training for the trauma-informed approach a couple of months ago, so we can look forward to training, I'm sure, as part of this pledge as well, right throughout the organisation, including members. Fifthly, to focus on the health gains. Sixthly, to improve food and drink environments. Seventh, to create healthy environments, in particular to enable people to be more active. And of course, sport and leisure are within the remit of this committee as well. Eighthly, to increase access to nutritious, affordable and culturally appropriate food. Ninthly, to involve communities, and finally, to learn from this and to share successes and acknowledge the challenges. Those of you who are observant and follow me on X and whatever the other thing's called, and Facebook, will have noticed that I posted some pictures of me looking rather younger, swigging champagne, I'm afraid, I don't know whether that's healthy or not, in the room next door on being elected as an MP 20 years ago. The first speech I made as a shadow minister for public health was on obesity, the ticking time bomb. So that time bomb has been ticking for quite a long time. So hopefully this pledge, this whole systems approach is actually going to make a real impact on that ticking situation in Bristol, so we don't have an explosion. That's the end of that metaphor. Right. Any other observations and comments from committee members? I'll take Lisa first, then Patrick, then Tom.
Thank you very much for that report. This is obviously a really important and vital initiative. Really great to be signing up to this pledge. It really links in with lots of work that we're doing in the council on health inequalities, access to food, all the prevention work. I guess we just need to remember that it's focused on action, so it's not just about signing up to a pledge. That actually has to be sort of action as a result of that. So really pleased to hear that we're going to be taking on 3 actions as a local authority. Do we know what those actions will be? And then how are we going to monitor the result of signing up to this pledge, and also what the other organisations that have signed up will be doing in terms of their action plan?
Sally?
Thank you, Lisa. So I'll take that in little bits. So the other organisations are all going through the same processes that we are, and they will, as their senior leadership teams, so I'm just thinking about our acute trusts at the moment, it's been to senior meetings right the way across, and they're looking at the pledge commitments and thinking about what they can do to really make a difference. So we've, one of the things we've done is developed an online learning tool for weight stigma. And that might be one of the things that they commit to, that all staff will go through this short learning tool. It might be one of the ones that we do too. It doesn't have to be something that is absolutely time consuming. I mean, we are doing so much in within a council environment, that this is about adding value and starting to monitor and evaluate. We've got some funding to evaluate formally, but at the same time we'll also be doing local and smaller evaluations we really want to be able to show some progress, of course, and we might have to think of things that are slightly different in order to show that progress. So things we wouldn't necessarily think about measuring in a more traditional way. So a lot of measuring in public health is looking at very long-term outcomes. Well, we will want to know long before that whether we're making a significant impact or not. And I can't remember what else you asked me, sorry.
I asked you about sort of monitoring the other organisations as well.
Yeah,
So,
we'll
yeah.
definitely be doing that.
Yeah.
So we currently have a steering group made up of all the organisations, and that in time will morph into a sort of community of practice, so that the support and idea sharing, and we're having a proper launch stroke conference in October, which you will receive invitations for.
Thank you. Patrick, next.
Thank you, Chair. I think this is something to be welcomed. I think it's really important to note and positive that the report's not, and this pledge, it's not focusing around shaming people for their weight.
Absolutely.
We know, aside from anything else, from being cruel, that doesn't work in tackling obesity. And it's that the focus is on providing that systemic change in the city that we need to see. Lisa's question slightly gazumped mine, I think, but around the sort of monitoring and the governance of the pledge, I'm particularly interested in how, given the equalities impacts of this item, how will the council be meaningfully engaging with sort of minority communities and disabled communities, given that sadly that is often quite difficult to do for the council, although it really, I think we've spent years wondering why and trying to improve that. But given I would like to hear a bit more detail about how we're intending to do that, please. And equally on issues like tackling food deserts, these are really long-standing structural issues, so it'd be great to hear a bit more detail on how we intend to go about that. Thank you.
So in terms of working with specific groups, we're already doing some of that work and will continue to do so. So we are asking people what it is that are barriers to a healthier life. We will start some more in-depth work on specific groups, but through our communities team, we already have access to lots of communities already doing lots of work, particularly in the food and the physical activity realm. And we are also responsible for public mental health, so have done quite a lot of work around Train the Trainer in providing mental health training, mental health in workplaces. So lots of things in Train. Not all of them are set up yet, but the ambition is certainly there.
Tom?
Well, as Lisa preempted one of Patrick's questions, Patrick has preempted one of mine. I think there's a lot to talk about when it comes to food deserts. And it's really good to hear about the psychological support. You just mentioned the mental health support as well. I wanted to ask what plans there were to engage with the ICB and other actors on mental health, and really to make sure we've got a very holistic approach on that, because I think there's a big issue here. I mean, it's certainly a contributing factor that hasn't always been grappled with well. So it's really encouraging to see that this is part of it, really encouraging to see it's trauma-informed, but I'd like to know just a little bit more detail on how we'll be working with others to really address that.
Okay, so this is one of the 3 key commitments on prevention from the Integrated Care Board and Partnership, and it's in the forward plan. Now, that might change over the next year, but we're hoping that all of those, so it's tobacco control, drugs and alcohol, and healthy weight, which puts the Integrated Care Board centre stage in this, really. along with all of the partners. Not one partnership can do it by themselves. It's got to be all of us driving in the same direction with the same ambition and really wanting to tackle this. So yes, they are absolutely on board. Jeff Farrer, who chairs the Integrated Care Board and Partnership, is absolutely with us on this one and has been in lots of discussions. So I think I can safely say that they are really committed.
I'm glad to hear that. I guess my sort of follow-up question on your answer would be, in terms of our liaising with them, is that going to be like a sort of structured meeting every few months, or have we, developed our plans for how we're going to keep rolling that on, keep making progress?
Yes. So at the moment through the steering group, so we have representatives from all of the organisations in the integrated care system, and then moving on, we're going to definitely have a community of practice and a working group. Again, all of the organisations will be involved in that, and all of those people will be at an organisational level where they can go up and down. Because obviously if you're talking of some of our very big organisations, here is a good example, then it's very difficult to get that information right the way across to everybody.
And last question, I promise. Will this be primarily officer representation on this, or would this also tie into councillors, for example, on the Health and Wellbeing Board? Would they be attending these? How would that interact?
So the Health and Wellbeing Board will have the ownership to all intensive purposes, and we will report to the Health and Wellbeing Board. We are very happy to come back here and provide you with briefings as appropriate at any time. So we really appreciate your time and energy in this, and hopefully together we can really make this happen.
Oh, and I think we all appreciate all the time and energy that you and other officers have spent on this as well. But thank you, that's really reassuring.
Yeah, so as Sally just said, the Health and Wellbeing Board will have ownership on behalf of Bristol. The Health and Wellbeing Board itself is a partnership body, of course. There are 3 councillors on it. I chair it, but Lorraine Francis, representing the Adult Social Care Committee, and Christine Townsend, representing the Children and Young People's Committee, are on it as well as members, so they can feed back to their committees. I've got a couple of questions for you, Sally. A lot of these pledges, and certainly the trauma-informed one, I think, looking at who signed it, are predominantly the public sector all signing up to do something. Food, it's the way it is and the way it always has been, but you might think it's actually unusual if we were starting from scratch. It's an essential item of life, obviously, but it's almost entirely provided by the private sector, unless you're in prison or hospital or having school dinners. What discussions are taking place with the private sector, in particular with food retailers, as to what they can bring to this process?
So we have a very good relationship with many food providers across the city, particularly with Feeding Bristol, who we support as a public health team, and we work very closely with them. And I've forgotten the name of it. Another Good Food, I think it's called Good Food Active. And they do this sort of overarching work along with some of my team. We have a food equality strategy and action plan, which is, and they're working towards many commitments out in our most deprived communities. We work very closely with food banks to think about how we can get to a point where food banks are not the central, but they are what they're meant to be for urgent requirements for food. But we have many other things now going on around the city with children's kitchens, things going on in children's centres. We have food hubs where people can pay a small subscription fee, and each week they get a food parcel with recipes to explain how to make the food, the culturally acceptable food in that area, into a meal. We have healthy schools, which we're all trying to move in the same direction with this, and very clear messages. So many things going on. I could probably be here for the rest of the day, so I don't think you'd like that.
What I was sort of getting to is it likely that we'll have meaningful and productive conversations with food retailers? I mean, if we're going to see, we can campaign all sorts of things. We can transform how the city council, how staff think about food, how our staff who engage with the public perhaps help transform the way they think about food. But ultimately, if the retailers don't change the way they stack things, the way they market things, given that successive English Westminster governments have been less interventionist than, say, the devolved governments in Cardiff and Edinburgh. You think of things like minimum price for alcohol, the placing of product rules and so on that they have in Wales, advertising constraints. In England, we operate, whether you like it or not, in a more trying to think of the right word that isn't going to be politically pejorative, but in a more relaxed way then, in terms of public health, which some of us who are more interventionist may have not been in favour of in the past. But are we likely to get movement from retail? I'll ask Sally to answer first, and I think Christina's got something to say.
We are working hard with government through the Faculty of Public Health to really get the food agenda pushed right up there. I sit on a national committee for healthy weight, and again, we're pushing to get this onto an agenda. Unfortunately, it's very difficult to do things locally. Sometimes you can have some success with a local supermarket, for example. What is very interesting is that many of our deprived communities don't use supermarkets, they use corner shops. And I think there is we started this before COVID, but there's a very interesting piece of work to be done with our chefs around how we provide healthy food at a very reasonable price. It may be in the form of microwave-type meals, because we know that more people have a microwave than are able to use a cooker, for example. As I say, I could be here for many hours talking about this. So, but just to give you a flavour, we are definitely working at it, but we do need national government as well. Sorry, Christina.
Christina.
Thanks, and thanks for the question, Stephen. What we're talking about here are the commercial determinants of health, and this is precisely why the pledge is framed in the way that it is. That, of course, we will continue, as Sally's described, to provide individual weight management services and lifestyle support, but that actually we need to go up a gear and understand where the levers are. Now, there are levers in the city that we can apply through our networks and through regulatory processes. And Patrick, you mentioned food deserts. As Sally has described, to influence, say, the big supermarket chains, your Tesco's and Asda's and so forth, that really have a lot of power and influence and a big presence, particularly in our more challenged neighbourhoods. That does require national policy, and the national public health organisations are working, Association of Directors of Public Health, Faculty of Public Health, the Royal Society of Public Health, all at one on this. And I think it's quite a nationally cross-party political issue. There are champions right across all the political parties in government in terms of from a national perspective, what are the levers that we might that could be deployed to ensure that we're not creating obesity and unhealthy weight through our commercial activities.
Thank you. Abdul?
Thank you, Chair. Really welcome this exciting approach to, kind of making schools, workplaces, community groups, and the council and its activity healthier. The campaign, I know, kind of had a earlier version in 2020 called the Healthy Weight Declaration. What was the progress on that, and how different is this one compared to that?
So this one is not just about one council, this is about 3 councils, all of our NHS organisations, and which creates that leverage to do something bigger and better. So we have done many things here as a council already as a result of the pledge, but we're certain that we can go much deeper, as Christina was saying, and use the levers that we've got to really make a difference. And that will be easier to do if we've got our, particularly our acute trusts on board with us.
That's great. And I just want to make 2 points about, one about Ashley, Easton and Lawrence Hill, where I feel that there is easy access to takeaway and unhealthy food compared to healthy food, and I think that we need to make that better. And I think that it's really important that the campaigns that we launch don't ignore structural causes of poor health, which could include poverty, housing, racism and trauma, and I think it's really important that we focus on those things too. Thank you.
Absolutely agree with you. And we do indeed need to do more around hot food takeaways. It's very complex and we have tried for a long time, but I think we need to resurface it and have another go. And I can explain to you why that is, not offline.
I suppose when I say that, I'd like, there are various opportunities within those wards to make that better, but it's just engaging at the right level and making sure that we have taken on the right partners. Thank you.
Thank you.
Carol?
Thank you very much. Thank you so much for highlighting this. It's a really important area for lots of different reasons. And I've got a few questions that kind of rolled into one, so bear with me. I just wonder how we're going to monitor effectively, what we're going to monitor. Have we looked at cause and effect and the equality, the impact of equality? And raising that, and this is where it all rolls into one, because you've mentioned several times that it is a very complex area, and it is. And just one strand of that I'll pick out that you also mentioned is about ethnicity and background. And I'd like to suggest and request, if it's not already done, that we look at the charts as well, because from my point of view, they're quite Eurocentric. My entire life, according to those charts, I'm overweight, and which I'm not, but if I were to go by the information that is provided, that could be quite pathological. And as Bristol is a diverse area to live in and becoming increasingly so, I am concerned that we would be oppressing those communities further by the information that we are providing, because it doesn't translate in the same way as it does for other communities.
Thank you. So the National Institute of Clinical Excellence is actually looking at that, the way we measure people, the way we have those whole conversations. It's not something that we can just pick up and run with in the same way as the child weight management programme. But it's definitely on agendas, I can assure you. And I'm part of a health integration team, which is part of Bristol Health Partners. for healthy weight. And one of the paediatric consultants sits on that group. So I'm getting some feedback quite early on, and it's very definitely on the agenda.
Yeah, that's why it's important who does the research and that we understand who's actually providing those figures, and also that we are looking into those communities and just making sure that the information is accurate for everyone. And someone just said a moment ago that we need to go up a gear, and I agree with that totally. And I think the way that we do that is to not just make the pledge, but to put actions behind it and make sure that we hit the ground running. Thank you.
Thank you.
Yeah, I mean, Carol makes excellent points there, and measurement is been quite a controversial topic for a long time, isn't it? I mean, I don't know how many of us around the committee have had our BMI measured at some point in the past. There is a machine, for those who don't know it's there, in the cash hall downstairs to measure your blood pressure and your weight and everything else. And I went through it a few weeks ago. I'm going to declare my weight. You don't have to do the same. I'm 75 kilograms, and I think I'm not in bad shape for a man in his late 50s. But I think the BMI measurements shamed me, and that's probably because I swim. I've got muscle rather than fat in various parts of my body. So how can we perhaps get in place meaningful measurements that are, as Carol says, culturally and ethnically sensitive, but also common sensual as well, that people can understand how they are weighed, what the measurement is actually meaningful, understandable to them, and doesn't actually cause undue anxiety.
I hear this conversation an awful lot around my work, and it isn't something that we can just do. But I absolutely note it. What we can do, though, is make the environment easier for people to live healthier lives, and that's within our gift to an extent. And I think we've got to focus on that rather than individual weight, while we wait for the next iteration of the National Institute for Clinical Excellence and others and I imagine that in time it will change, but certainly not at the moment.
So do you think then we also need to look at the way that we send the message out?
I think perhaps we do. I think there has been some work done on that, but I'll take that back and have a look at it.
I've got a couple of more things. We're just checking whether committee members have anything else they want to bring up. Right, I've got two extra things to bring up, Sally or Christina or Emma for that matter. I mentioned the ticking time bomb phrase from 20 years ago has been repeated quite a lot in the intervening years, and a lot of that has been around obesity, and it's linked to type 2 diabetes. And type 2 diabetes, correct me if I'm wrong, is a condition that is, one, preventable if people take the right actions, but also, unusually for a condition, is reversible. What data do we have about the incidence of type 2 diabetes in Bristol, and where could we make the most impact, either to prevent it occurring or perhaps more importantly to reverse it amongst people who currently experience it?
There's been a lot of work done, Stephen, around type 2 diabetes, and we do have data. It won't be totally correct because there'll be a lot of people with type 2 diabetes that don't know they have it. But you are right, it is largely preventable, and in some cases it's reversible too. And it's very much part of our big picture.
Okay, right, I've got one final sort of wrap up question, and because Emma hasn't had a chance to speak, all three of you can give an answer to this. What will success look like in 2030? Sally, you can go first. Emma, you can go last, which gives you time to think.
For me, it will be a reduction in particularly our deprived communities where there isn't this gap between healthy weight and everybody has access to healthy and nutritious food at reasonable prices.
That's more than one.
Oh, sorry.
One each.
I'm on a roll.
Right, so impact in our deprived communities is what I'm going to take from Sally. Christina.
Okay, I was going to just respond to Carol's question and comment that we do have an opportunity to address what is structural inequality and structural racism within the way that we perceive and ask the questions. And in fact, we've got the National Race and Health Observatory is doing a lot of work on this, a lot of work with Marmot. And it is about who asks the questions, how are the measures made? And I think in Bristol, with our academic and other colleagues, and with the connections that we've got with the Race and Health Observatory, we could do something really quite exciting on that.
Thank you. No, that's okay. I think for me, success would look like this pledge and the principles within it being embedded across the whole council and all considered in all activity that we do, as well as across the wider system, working towards a place where we have a healthier population and reduced experience of stigma and discrimination.
Great. Thank you very much. I think that was a very good conversation around the table. I know I've said this before, but I will say it again. It does prove the value of having 9 eyes on a key decision rather than one pair. Right, but we do have recommendations, and they are that the Committee for Public Health and Communities is to endorse and support the Why Wait pledge for creating healthier places together in Bristol as part of the wider implementation of this as a whole systems approach to healthier weight environments and obesity prevention across Bristol, North Somerset and South Gloucestershire's integrated care system. An organisational certificate showing our commitment to the pledge should be signed by the Public Health and Communities Policy Committee chairs, which we will do imminently. And secondly, agrees that Christina, as our Director of Public Health, will have oversight of implementation of the pledge in Bristol City Council and will provide assurance to the Health and Wellbeing Board for Bristol, who will be accountable for local pledge implementation. So I'm moving those recommendations. Can I have a seconder, please? Councillor Blenkinsop, thank you. All those in favour, please indicate. That is, again, unanimous. Thank you very much. We'll now take a break for just after 11s, and I'm sure there'll be no sugar in any of our coffees or teas. And if we've got the person who's taking the picture, he's waving, we do. I will now sign a pledge, which is going to be produced for me, and I'd like all members of the committee to join me up here to be in the picture. And then we will actually have a break, and we'll resume at, by that clock, 25 past, which gives us time to do various things. 11:30. We now come. I'll just alert members. I think most of you got your emails open. Programme that enhances the verges along the city's highways and also in our parks and landscapes, and increases tree canopy cover whilst offsetting the impact of the loss of ash trees made unsafe by ash dieback disease. The reason this is coming to the committee, it's a key decision because it does involve both capital and revenue expenditure of over £500,000, and it has a citywide impact on more than 2 wards. Right, so there's been a change of officers at the top table for this. So I'd like to introduce Patsy Mellor, who's the Director of Management of Place for the Council, and to Patsy's right is Richard Fletcher, who is the Head of Parks, who's been newly promoted to an enhanced position within the Directorate. So congratulations in public to you, Richard. So, Richard, are you introducing the report? Okay, off you go.
Thank you, Chair. Is that working? Sorry, just checking. So obviously, we all understand the importance of trees in the city, that they help define and frame the landscape all around us, give us a sense of place. They offer important wildlife and ecological habitats. They make people feel closer to nature. And we are more aware than ever of their urban cooling impact. These are the benefits. However, Bristol's treescape is slowly beginning to change from the impact of ash dieback. Ash dieback is a wind-blown fungal disease which first came to our shores in 2012 and is impossible to stop in terms of its spread because it is a wind-blown fungal disease. It reduces and removes the leaf canopy in an ash tree, hence its name, by restricting the water flow. And because it restricts the water flow, it makes the tree brittle and prone to failure, which in turn means that ash trees that are affected become a health and safety risk to people and property in the city, and something we need to be concerned about and dealing with. The Tree Council reports that an estimate that 70% of ash trees across the country will die as a result of this disease in woodlands. And the council, through observational surveys, has estimated that we have 30,000 ash trees in locations in the city that could cause harm to people or property if they should fail. Those same observation surveys tell us that there are 10,000, a third of those, that are in an advanced state of decline as a result of the disease. And a third of those, again, are estimated now to need works in order to make them safe and or need removing to maintain safety. At the same time that ash dieback is acting to diminish the city's tree canopy, the council and the city has a target to increase our tree canopy up to 20% in the next 15 years. And this programme, therefore, proposes that we combine our efforts to remove the highest risks from ash dieback while delivering a new tree planting scheme that can help make our highway networks greener, help restore and enhance our open landscapes and our parks, continues to deliver our tree canopy aspirations, and we can target areas that help tackle urban heat stress and expand nature into new spaces, and of course the ongoing effects that will have on people's well-being. We will be targeting tree planting as part of this close or at locations where we'll be removing trees so that we mitigate the impacts locally, but also looking for more opportunities to have schemes that enhance the landscape. In woodlands, where tree canopy will be lost because ash trees in woodlands are particularly vulnerable, largely we will be relying on natural regeneration to replace the tree canopy. whereas in open areas where that natural regeneration is unlikely to happen, we'll be concentrating tree planting. We are not ring fencing away planting trees in woodlands, but it is not going to be necessarily our focus, because the best case scenario is sometimes to allow it naturally to regenerate. We understand that where trees are going to be removed as a result of our dieback, and where trees will be planted, are of interest to local communities. So we will make sure we inform local communities of what we're doing and why. We will have a communications plan to that end, and we'll be obviously informing elected members locally of our plans as we work through the programme. We do have an ash dieback webpage, and we'll be enhancing the information that's already on there as we go through the programme. Our approach to removing and undertaking works on ash trees is set out in Appendix A to this report, and we'll ensure that that's on the Council's ash dieback web pages for people to see. And that approach ensures that we are mindful of the costs of doing this work, particularly in the long term, but also the value of mature trees, the value that some trees play in the landscape, and the value to habitats also. The proposed programme is over 3 years. It proposes to commit £1.9 million of capital funding and £930,000 of revenue funding over that period. The revenue funds will be directed solely at mitigating the risk from ash dieback, and the capital funds will be used to combine that risk mitigation work with tree planting, so that the canopy cover impact to the city is overcome. And a proportion of funds will need to be used to increase our resources to help develop and complete the works. Our current cost projections of the advance of the disease suggest that the funding that we have won't solve the problem for the city, and we will need to have an enhanced tree risk management programme beyond the term of the project. We will keep this under review as the programme progresses, and as we gather more information, as we're going out doing tree works, and have a firmer view to report back by the autumn of 2026. And finally, the other thing that we're asking for today is approval for a new framework contract at a value of 2.7 million to ensure the council has a number of routes to procuring tree works should we need them, and that procurement therefore doesn't become a barrier to making the desired progress and spending the funds that you're going to allocate. We're not committing to this spend, but just ensuring that that level of spend can be accommodated through the contract. Thank you, Chair.
Okay, thank you, Richard. And as you say, a good place to look, not just for members of the committee, but for any members of the public who are trying to understand the decision-making process as to whether a tree should be removed, how much of it should be removed, and whether cuttings are left in situ or not, is covered in Appendix A, which is quite a good diagram and a narrative on the back of the diagram as well. Right. Any comments and observations from the committee? Councillor Blenkinsop and Councillor Levan.
So thanks for coming and speaking on this. I was a bit worried about this because it's really reassuring to hear about the tree replanting, because on first look the paper seemed to primarily deal with cutting down trees more than anything else. I was a bit worried about the double thing. I am curious though, you mentioned that they will be in around the same places, that they will be put in place around there. But it's also noted in the impact assessment there will be a short-term effect on the canopy. Given that these, I would assume, would be younger trees, what would short-term impact be in this case on the canopy? What does short-term mean? Are we talking years and years? Are we talking, because trees do last for a while?
Well, I think the thing to note is the canopy impact is going to happen anyway. The canopy is dying back, and we're going to lose it. So it's not going to be the effect of us removing those trees that has the impact on the canopy. That impact is happening. So obviously when we plant trees, it's going to take some time for that canopy to grow and overtake what has been lost. In terms of timescales, probably 15, 20 years maybe to get to that point. Regeneration in woodlands should recover probably quicker than that. So the impact of ash diebacks, the loss of canopy in woodlands will recover more quickly. We predict at the moment that overall, or we can commit at the moment to our tree canopy increasing by about 10 hectares as a result of this programme alone. But we also have other tree planting programmes that will continue to add tree canopy in the city.
It's good to hear that there will be more tree canopy in the future. But I have the impression, I would really welcome you to correct me if I've gotten this one wrong, because I'm a bit worried about it, that in some areas we'll also be removing healthy trees because they might be at risk, or because it is an appropriate, you know, it is expedient to do so. Would that be unfair to say?
No, I think that's part of it. So we're obviously targeting trees that at the later stage of having ash dieback. That means that their canopy cover has been lost by at least 50%, because they're the ones that create the most risk. Because ash trees are risky to deal with to the operator, they are quite high cost to remove sometimes and to have works done on them. It's seldom that an arboriculturist can just go in and fell a tree from the base, or take limbs off as they go down and then fell a tree from the base, because they're not allowed. It's not safe enough for them to do. So for that reason, we need to bring machinery in. That adds to the cost. We're obviously needing to do ecological impact assessments on loss of trees and understanding what our mitigation might be. So that the cost of dealing with ash dieback is proportionately much higher, about 80% higher than a normal tree works. So that means that there are some circumstances where the costs are high. So for example, if we're doing road closures or traffic management works, adding on to those other costs, that we might choose to proactively remove trees because they're almost certainly going to get the disease, or very high probability of getting the disease, and dealing with it all in one go. The long-term impact of not doing that is just higher and higher costs of dealing with it. So Appendix A does set out our thought process around that, but it is something, unfortunately, we're probably going to have to do in some circumstances.
So, and again, just to return to the point of location, so there will be some areas where we will be basically dealing with a lot of trees at once. I understand the rationale behind that and the reasons around the expense, but this leads me to suspect there will be some roads and some areas that will then not have proper tree canopies, tree shades for 15 to 20 years. I would like to have a rough idea, if we have a rough idea, of where some of those places are.
I think that's fair. So we're working now on trying to provide some map-based information that we can put on our ash dieback page so people can understand where we're targeting. At this stage, it won't necessarily be exactly where we're removing trees, but it'll show you the areas of high risk in the city where we have ash trees, where we know there is ash dieback, and we need to focus on those areas. So that'll be something people will be able to see, and hopefully that aids with communication. The good news, I suppose, is, or some solace, is that it's rare that ash trees are kind of planted as street trees. They're not very good street trees. So the majority of them will be a little bit back, possibly from highways, adjacent to green spaces where highways and green spaces meet. But yes, we can't hide away from the fact that, as I opened the report, is that ash dieback is going to have an impact, albeit temporarily, on the tree canopy and landscape in the city.
Yeah, I certainly understand that, I understand where you're coming from, particularly in the lifespan of a tree. I'm just struggling to get my head around 15 to 20 years being a temporary situation. Last one, I suppose, would be, in terms of replacing trees and taking the point you've just made on ash tree generally not being good street tree, what kind of trees would we typically be replacing these with? Just out of curiosity.
In terms of species, it's difficult to do a list of species here, but obviously the right tree, right place is the guiding principle. So what we mean by that is, if it's going to be an area which is next to residential property, are we putting something that's not going to grow like some of our very large plains have, which were great at the time, but can cause kind of access issues? We want to avoid that. So right tree, right place. We need to make sure we're planting a range of species, because in 50 years we're losing one tree, which is an elm tree, and now we're losing ash trees. This is a big issue for the country. So we want to plant a diversity of species. We want to provide a variety of habitats. We will be looking at a lot of native planting still native trees. But there is an opportunity to make sure that the right size tree is growing in the right place and not causing other problems, particularly with access. And the Equalities Impact Assessment, makes a strong note of making sure that we're cognizant of the impact on access when we're planting and where we're planting.
Okay, thank you.
Tom, you mentioned where. This is a dynamic process because all we're doing today is approving the budget for future works because we think the scope of it is going to increase enormously, but some works have already been taking place, including in your ward along the Portway in January. And the other thing I think it's worth saying, Richard, is not just the City Council as a landowner that's having to deal with this. It's all landowners, so along the Avon Gorge, which all of us value, whether it's our ward or not. The National Trust, Woodland Trust and other trusts that own that forest along the gorge are having to deal with this as well. It's fair to say, isn't it? I'll come back to you.
That's absolutely true. So we know that most major landowners will have an ash dieback programme in place. Our neighbouring authorities do also. So we've been in touch with those authorities early in the process. They're allocating budgets themselves to deal with this issue. You can see it everywhere you go, and in fact, on my driving in this morning along the Portway, I was looking on the other side of the river. I can't stop looking at ash trees now. And you can see the impact of ash dieback on the canopy just on the other side of the river. So they have had a tree removal programme within the National Trust element of Lee Woods, and the Forestry Commission have on their element also. Yeah.
You want to come back on that?
Yeah, it was really, because I think, thank you for bringing up the Portway, because that is one of my concerns. If I'm going to tell residents on the Portway they are not going to have trees, shade, canopy for 15 to 20 years, and I think other councillors may be in similar positions, we'd like to know early and we'd like to be able to take steps to mitigate this and help people address it, especially with what we all know is going to be the increased impact of climate change. You've already mentioned how helpful trees are in reducing temperatures, how helpful they are for the environment, how nice they are for the area. So if they're all going to be cut down and removed, we should know as soon as humanly possible. And I think I will be charitable and assume we would all like to have as few trees cut down as we can reasonably manage. I appreciate the position, but I don't think any of us are happy about these trees coming down.
Well, as Richard says, they would come down naturally. The reason that the officer might want to put this in different words, but the reason we are having to take this decision is we have to have in our minds the safety of the public. I think residents of Avonmouth and Lawrence Western or any other ward would be even more concerned if a branch fell on a bus, a car or a pedestrian or a cyclist going along the Portway, and that's the really difficult balance we've got in front of us. As Richard says, the trees are going to go anyway. We're just making sure they go in a safe way to the public. That's what's in front of us. Right, I've got Cara next.
Thank you, Chair. Even though your party leader hates tree huggers, it sounds like you might be one, Tom.
I like trees.
Everyone, we all love trees. Thank you so much for this paper and for the briefing that you gave us, which shows how carefully you've had to think this through, even though it's been delayed for a long time in coming, and we've known it's needed to happen for a long time. And especially for finding the funds to be able to mitigate the cost of cutting down trees and coming up with a really well thought through tree planting programme. And just want to really give some credit for all the work that you've done on that, and thanks for sharing that with us in the past. I wondered if you've been looking at exploring avenues for using felled trees. For example, can we chop them up, use them for fuel? Is there anything we can do to sort of further mitigate the cost of the sad loss of all these trees?
That's a very good question. I mean, our first potential use for the trees is as habitat, if they're cut down, as has been mentioned before, from members of the Bristol Parks Forum. So that's always an opportunity. Deadwood is a really vital wildlife habitat, so we're almost certain to use trees in locations for that. We haven't seriously looked at whether we can sell ash wood. Our tree contractor does use trees that are felled in the city on a health and safety basis, on an ongoing health and safety basis. They do recycle that wood for fuel. That's part of our contract agreement. So almost certainly some of the ash trees will go down that route where it will continue to be recycled and used as wood chip fuel, which they sell on. So that's a good kind of at least environmentally friendly route for it. I think there are potential issues of selling wood within the city when we know, smokeless zones and what have you apply. It's not impossible. The other thing, obviously, is there's lots and lots and lots of dead ash trees out there that are being felled, and there's lots and lots and lots of wood. I would imagine that the market in terms of selling wood is not particularly healthy. But I think it's a good point, one that we haven't really looked at seriously. So we'll give it some observation and maybe talk to our tree contractor about what the options are.
There is the chip-in plant next to the Blaze Nursery, isn't it? Well, yeah. Right, Ed next.
Thanks very much, and thank you, Patsy and Richard, for bringing this report across. And I hope it's not glib to describe, the situation of ash dieback over the last 12, 13 years in this country. It's, you could almost equate it to COVID, the way it's spread around, the really pervasive and devastating effect it's having right across the country. First question I wanted to ask, could you estimate how many trees have been infected with ash dieback within the city in the last 3 years or so?
I probably can't. What I can say with reasonable confidence is that the progression of the disease is fairly slow. So over the period that we have done visual assessments, which is a long way from being certain about the impact, it's probably increased by about 5% in 2 years. So I think what we're dealing with at the moment is, if ash dieback appeared in 2012, and we know actually one of the earliest signs of ash dieback was in North Bristol from memory, Matt, but I think that was one of the earliest signs. It was from trees that were imported and planted as part of a scheme in North Bristol, beyond the Bristol boundary, but within the Bristol conurbation. And so we're probably dealing at the moment with a legacy of several years of ash dieback. So once we've got through that legacy, the amount that we probably have to commit year on year to dealing with it will reduce. Mm-hmm. But my observation is, again, if you look at the Portway this morning, I was in the Cotswolds at the weekend. If you go to Mendips, the sheer level of loss is almost total. So that might be coming our way, and it might just be some environmental conditions in Bristol which are holding it at bay at the moment. It's difficult to tell.
Okay, well, that makes it, I understand it might not be possible to give exact numbers, but we're certainly talking about the hundreds here. There are 3,000 or 4,000 currently that are going to need some kind of remedial works according to the report, and there is a risk of that kind of exponential curve going as you've observed in the Mendips and the Cotswolds, for example.
Yes, so 10,000 trees we estimate at the moment have got stage 3-4 ash dieback. So it's going to go on from there, but we don't have to consider every ash tree in the city. We've mapped about 30,000 ash trees that are in areas of higher risk. Where they are outside of those areas, they don't pose a risk. Nature will take its course.
Fantastic, thank you. And I hope that provides some reassurance in terms of we're reducing the amount of trees that would need to be felled entirely or cut back as much as is reasonable. So I understand that there were some similar proposals relating to ash dieback works that were brought to the former cabinet in January 2022, but it was withdrawn because the council was unable to identify the funds necessary to implement what was needed. Can I confirm that's correct?
Yeah, so in parallel of going along that pathway, we were desperately trying to find ways to identify revenue funds, bearing in mind this is a revenue funding issue when it comes to tree works, in a very challenging kind of environment. We're still in that environment, really, so which is partly why we're combining capital and revenue funds together to try and make more than the sum of the parts. So our focus is on the safety of the public, so we will be spending some of that capital on tree works, but we'll be combining those into schemes where we're enhancing the environment through tree planting and getting both things done at the same time, basically.
Yeah, and I'm really reassured that this report and this proposal includes very significant investment in improving the tree canopy for the future, notwithstanding the amount of time obviously it takes for trees to grow. But essentially, had we had funding been identified back in January 22 by the Cabinet at that point, more than 3 years ago, we could have started dealing with this issue then, and the amount of trees that we're talking about here in this project could be significantly smaller.
I think this is a matter of timing. So we could have obviously started earlier. That would have been great. But again, I go back to the disease, and the impact of the disease is going to progress, how it's going to progress. So we'd either be dealing with those trees 2 years ago, or we're going to be dealing with them now, or we're going to be dealing with them in 2 and 4 years and 6 years' time. The fact is we're going to be dealing with those trees.
Absolutely. Thank you very much.
Following on from Councillor Fraser's points about funding, of course, this has been met from within our own resources, capital and revenue, but it is a national problem. Are you aware of whether DEFRA or any other part of the government has considered funding local authorities to deal with this situation?
At the moment, there don't appear to be funds coming through directly related to ash dieback. There has been, annually, we have been able to take advantage of grant funding that is government sourced for tree planting. It isn't in itself targeted at the replacement of ash trees, but that we have benefited to the tune of about £300,000 a year over a few years from government funds to plant trees. So that's available, and we all know that the Western Forest Initiative now, there are funds targeted at planting trees across a very broad area. It includes Bristol as part of the Western Forest. And there may be schemes and more grant schemes coming through from that, and we'll be in a good place because we've got really strong relationships with partners to take advantage of those funds when they arrive.
So just to add to what Richard's just said, and just to reassure about the canopy, I mean, last year the Park Service celebrated their 100,000th tree planting. I think it was May, but it was last year. So, over the last few years, we have planted 100,000 trees in Bristol. So that's on top of any schemes such as this. So there's some good news happening with trees as well. It's not all doom and gloom.
While we're in this, the financial situation of the council is something we're all aware of, and all local authorities are aware of, given that this is a national situation. The ash dieback is not peculiar to Bristol. I think it's worth us asking central government for assistance, whether it's just for Bristol or on behalf of all local authorities. So I can take this decision myself, I think. So I will write to the Secretary of State for DEFRA, which I think is probably the appropriate department, asking for financial assistance. We know government does occasionally give financial assistance for specific issues in local government, and given this is a national problem, I think it does require a national contribution. So I will follow that up. Tom?
We have
got Patrick.
Thank you, Betsy, and yes, I think that, as I said, I like trees. I'm very glad that under last council we did a lot of tree planting. I'm sure we would all love to see more of that from this administration, less tree cutting. Hopefully in the future that will be possible. What I would say, Stephen, just asking this, I don't know, I think this is the first time in terms of writing the Secretary of State, is that something the committee will have a look at, or is that something you'll just be doing on your own?
I think it's within my abilities to do so, and just to reassure all members of the committee, letters go from either the leader or the relevant committee chair quite often to government about things we would like to change, and quite often there was a whole flurry of them when we took office last year to the Secretary of State for Health, to Angela Rayner, and so on. And we send other correspondence through about things like a local government reorganisation, and they are agreed in between the chairs of the committees, but I don't think are routinely circulated to members of the committee. But it's basically going to be just what I said. This is a national problem. Why don't you help local authorities? Because while the money we are about to approve gets us through the next few years, from what Patsy and Richard are saying, this is going to a problem that is only going to grow, and it's probably going to outgrow the ability of the council's own resources to deal with it. And given that it's a balance in between not just ecology but public safety, We wouldn't want somebody in Avonmouth getting a bus from the Portway Park and Ride to encounter a falling branch through lack of money. So I think it's worthwhile doing. Right, Patrick.
Thank you, Chair. And yeah, thank you to the officers for this. It's a distressing piece of work, but it's clear a lot of work has gone into it, so thank you for that. I do want to applaud the focus on replanting of trees. That is, it's a fundamental part of the equation. We don't want to see trees cut down at all, ideally, but given that where we are with this disease, we're forced to, so it's good that we're replacing them. And yeah, the council's focusing on public safety and also trying to limit its own liability as a landowner is key, especially in these financially straitened times. I would like to check, obviously we're going to be allowing for natural regeneration, as you said, in woodland areas. Outside of woodland areas, will we be able to see one-to-one replanting? When if an ash tree comes down, we replace it with a different type of tree on a one-to-one basis, or will that be, or will there be a sort of more of a case-by-case review of what's appropriate in the area?
I think the latter, but I think in terms of increasing canopy by 10 hectares, we'll at least easily do one-to-one, if not more than that.
Okay, thank you. I would like to echo Councillor Benson's point on can we get a list of this. I was just looking at the tree layer on Pinpoint, and it does include information about a species. It's been a while since I played around with GIS, but I think it wouldn't be too hard to pull that out and have a layer just for ash trees, so we can see, if not, it won't have information on the dieback, but it will show us the concentrations where and areas which are likely to be most affected. So if we could get that a layer of ash trees on Pinpoint, I think that would be really helpful for understanding the scale and the geographical distribution of the problem. Thanks.
We're definitely working at the moment on what map information we can share. We do have a lot of our trees that are mapped. We don't have individual trees mapped in woodlands, but we do have outside of that the majority of our trees mapped.
Thank you. Yeah, I think that would be hugely helpful. I did want to ask as well, what interaction with this replanting programme is going to have with tree planting through Section 106 and Community Infrastructure Levy funds. A lot of areas, my ward included, have a lot more tree money than we are able to spend because it's geographically ring fenced to an area where there just isn't space. So I'm wondering if maybe that we can be a bit creative in how we use some of those funds which are currently just sitting in a pot unable to be spent. We might be able to, if you pardon the expression, fell two trees with one axe here.
So area committees commonly allocate Section 106 to tree planting. So what we're doing here is in addition to our tree planting programme, which will run in parallel, and that takes advantage of grant funds, as I've said, but also SIL and Section 106 funds where they're available. So we'll be carrying on with that tree planting scheme. So overall, the city's tree planting will uplift as a result of this programme. So it'll be one scheme on top of another, effectively. In terms of individual Section 106 agreements, I'm happy to look at any schemes, but you're right in the sense that sometimes money has been allocated to tree planting from development where it's almost impossible to plant them. And if you're sticking to the description of the Section 106 agreement, then it is quite difficult. We can review those with the Section 106 officer, Jim, Cliff, and see if there are ways around that.
Thank you. It's just I've got some ash trees in my ward, for instance, and I've also got I think a few £100,000 of tree money which we cannot spend because there is no space to plant the trees in the geographical ring-fenced area. So it would make sense from my perspective to use some of that money to replace the ash trees in my ward if they need to be replaced, and then the central pot can be used elsewhere because we're clear we don't have enough money. That's not good. That might not be the case for every ward. Some areas might have less tree money. Some people might want to keep their tree money separate from this programme, but I think it would be a good way of using some of those latent funds which are currently just sitting there not really doing anything.
Yeah, I'll definitely take that as an action to talk to to section 106 and, well, planning contributions, manager Jim, and see what the mechanism is to try and reallocate those elsewhere. I don't know what that means. I'm assuming that means going back to the developer in the first instance, but with a good case, maybe that'll be fine.
Thank you very much.
I guess there's not much room on Brandon Hill, is what you're saying?
Well, I would agree with both of the points Councillor McAllister raised, although I'm not sure I would use as metaphor in this circumstance. I did want to ask briefly on the replacement vote, because I just had a thought on that, and somewhat in relation to what was said. Will highways have a bit of will they have an input on this? Because I know there have been some concerns around tree roots and how that gets into pavements, how that gets into roads, and taking Councillor Williams' point on safety into account, is that going to be something that's also being looked at as part of this?
Yeah, absolutely. So highways have a very well-trodden path, quality assurance path, which we go down when we're tree planting if trees are adjacent to the highway. So we'll be doing exactly that with any schemes that relate to the highway through this programme.
All right, thank you for clarifying.
Right, if there's no other points, I will just ask Richard, for the sake of clarity, I know you mentioned it in your introduction about the contract, but just in case people conflate points 1 and 2 in the recommendations before I move them out, because they're very similar numbers, but they're not the same thing. Recommendation 1 is about the amount of capital and revenue we're approving to be spent over the next few years, but recommendation 2 is more about who we might procure to do that work, and it's a slightly different number. If you can just clarify that so that people don't get confused further down the line.
So correct. Recommendation 1 deals with the budget that we're asking to be allocated. Recommendation 2 is the value of a contract that we want in place so that we can push tree works through those. The figures are very similar. That's just a fluke. The 2.7 million was calculated by using the revenue contribution in the programme, which is £900,000, adding that to the average amount of tree spend we do normally through our tree contract. Multiplying that by 3 years, you get 2.7 million.
Thanks. Thank you. I just didn't want anyone to think later down the line when they look at the minutes or people to point out on Twitter or whatever that the council can't add up. They are actually different things. Right, which I'm sure they'll point out in other circumstances. Right, so I'll now move to the recommendations. There's quite a lot to read out here. They are that the Committee for Public Health and Communities, 1, the Highway Landscapes Tree Planting Programme and the required 1,903,000 capital expenditure and 933,000 revenue funding allocation as set out in the report. Secondly, approves a new framework contract to the value of 2.7 million that provides an alternative route for tree works to be procured should the council's existing contractor not have capacity. Thirdly, authorises the Executive Director for Growth and Regeneration in consultation with the Chair, me and the Section 151 officer to procure and award contracts to deliver highway improvements and tree management works as required, in line with the procurement rules, routes and maximum budget envelopes outlined in this report. Fourthly, authorises the Executive Director of Growth and Regeneration to invoke any subsequent extensions or variations specifically defined in the contract or contracts being awarded up to the maximum budget envelope as outlined in this report. And finally, notes the implementation of the ash dieback protocol as set out in Appendix A. So I move those recommendations. Can I have a seconder, please? Councillor McAllister, thank you. All those in favour, please indicate. That is, your fingers up, Bader. That's 6 in favour. Any against? So by default, 3 abstentions from the 3 Labour councillors. So that is passed 6 votes to 3. We're going to take a very short adjournment now. I wasn't able to leave the room when the rest of you did earlier because we had a few things to sort out, but I do now need to leave the room, so I'll be back as quickly as I can. of the two task and finish groups that the committee are setting up. Rather peculiar title, but it's something we landed with that the council has used for a long time, but these are basically working groups of councillors who go away and do some thinking about some particular areas and then report back to the parent committee in due course. And the first one we've got up today is for looking at the opportunities for more commercial raising of money, both in our parks and heritage estates and also via our city events team as well, because this committee is, as well as responsible for parks and estates, which we deal with quite often at committee, something that hasn't ever come to the committee in the past, but I think it might in future, is all of the city's events, carnivals, festivals. The team that are responsible for that also report to this committee. We do bring in millions of pounds to the city every year, and that money makes an important contribution, a vital contribution to the running of our parks and estates, which broadly cost just north of 15 million, but we bring in around about 13 from various activities. And while the objective of this group is not necessarily to bridge that gap or even to make a surplus, it is to look at a lot of proposals that officers I know already have percolating away to sort of stress test them in a safe place amongst councillors, but also to come up with some ideas ourselves as well, and as was alluded to in public forum earlier, to receive contributions from the huge number of groups around the city who care about parks and spaces or festival as well, and will want to make them even more successful, and in particular financially. So what we're doing today, I'll just say to colleagues, and I'll say this about the next item as well, we're setting up this working group and improving the terms of reference. This isn't the time to have a big wide-ranging debate about the issues. That can happen within the task and finish groups themselves, and both of them will come back to this committee in November, when no doubt we'll have lots of interesting things to discuss. Right, so we've still got Patsy and Richard with us, and you've just gone out of my eyeline, Greg. The council does employ quite a lot of commercial managers, both in the parks team and the city events team as well, to look at these opportunities for raising money. And Greg Want is our commercial development manager. He's with us today, and one of his colleagues is Sharon Rednedge, who isn't with us today. But Greg, you may have something to say to questions as we proceed. But who's introducing? You are, Richard. Off you go.
Thank you, Chair. I'll keep this one brief. So as you set out, this is to ask the committee to establish a task and finish group to review commercial and income generation activities and opportunities in parks and green spaces and the city events team. The Parks Service relies heavily on income for its operating budget. Over the course of austerity, when general budgets have been reduced, because the Parks Service is not a statutory service that we necessarily need to provide, we have been impacted by those austerity cuts. Of course, every service has. But we rely quite heavily on our income generation for our operating budget. So if there's potential to be better at that, then we have the potential to improve services, obviously. So I know a number of members within the committee have expressed an interest to look at this. So point 2 says Councillor Stephen Williams has made a request to establish a task and finish group, but I know others have made that request too. The task and finish group will review our current commercial and income generation activities and processes within both the Parks Service and the City Events team. Put forward new ideas, hopefully for income generation and sustainability improvements. Review our future plans for income generation within those services. Understand the challenges and barriers that each service area faces to generating income within a local authority environment, and health check our appetite, I guess, for those kind of processes that are needed to be put in place to make that real, and to highlight areas where they feel value can be added and provide examples. In terms of where our main income generation is taking place, it is in our bereavement services, which is burials and cremations, which is part of the park service, in our Blaze plant nursery, which members have spoken about before in previous committee that I've attended, and I know there's a lot of support for the nursery. Implementing fees and charges, including events, but car parking also, and other fees and charges that we apply for use of parks. The licensing and lease of assets and land to third parties. And as Councillor Williams says, we are actively looking at some other ways to bring in more revenue, an expansion of the plant nursery, appropriate advertising and sponsorship, reviewing our assets to identify opportunities to increase income through leases and licenses, and any joint ventures with third parties for additional paid for activities. By way of an example, we have the Treetops course in Ashton Court, which is a paid for activity which people know and enjoy, which brings us a reasonable amount of income for very little resource input. And then in terms of events, the events team has done a great job in terms of promoting the benefits of Bristol as a cultural city. It's administered 185 applications last year, which is a considerable number. I know they work incredibly hard. They're an incredible team, so hats off to them. And Harriet is a member of that team and is here to answer any questions on that today. The income contributes to the cost of running both that team, so that it's self-funding, and generates income on behalf of the Parks, Downs and Harbour Estates, the total of £400,000 coming into those three areas. So a considerable income stream for us. And despite the difficulties in the market, the team's early projections for this year suggest that we will meet the same income levels as we did in 2024, but it is a very challenging environment. And then a final point, which is in terms of the events team's efforts to make events in the city more sustainable, building criteria into our contract award processes to improve our sustainable practices, and also into our expression of interest criteria where people are applying to hold events in the city, so that they will from the off consider their ecological and environmental sustainability. Thank you, Chair.
Thank you, Richard. Contributions from members? Tom?
I will very briefly note that expansion of the Blaze plant nursery, yes, absolutely. Second point on this is a small point. Obviously, one of the issues around these kinds of events, and I am thinking in particular an event that was not organised by us but that took place last month, there was quite a lot of rubbish, quite a lot of waste. Will the Task and Finish group also be consulting with Bristol Waste and other organisations in terms of clean up and making sure that's part of the sustainability and ecology as well? Because I wasn't sure if that was in here.
We can invite Bristol Waste to the Task and Finish. The event that you are referring to was an unlicensed event, and yes, Bristol Waste did help us clear it.
I am aware that we had absolutely nothing to do with that, but it is an example of the unfortunate realities of clean-up that we will have to face as part of this if we want to have more festivals, more use of these spaces. I think we'd all like to also see them tidy and clean, but it's good.
So where we do have a licensed event, you know, that they have to have a plan on how they're going to deal with litter, recycling, and unfortunately when we have unlicensed events that are not there, we lose that control. So we are taking steps to engage with the people who organise that unlicensed event, because the cost of cleaning up after that event, and I approved a spend approval yesterday for I think fence or something, £500 worth of damage that the Park Service has to pay for. So even though it is unlicensed, we are engaging and you know, making pleas that next year that they don't just leave the mess that was left last time.
And the Park Sympathy very much has my sympathy in terms of the additional costs. With regards to those mitigations that we put in place for licensed festivals, these are, I presume, typically successful. There's typically, yeah, that's good to hear.
Yeah, thanks very much. I just wanted to say a few words about what I see as the objectives of the group, and I'm really pleased to see this coming forward after we brought this to a previous work planning meeting a few months back. So the way I see the objectives of the group is that we should be making recommendations that will help get the Parks Department to a point where it can wash its own face. Financially, I don't expect the group to do that on its own. I'm in agreement with you on that, Stephen. And that this can act as a precursor to generating a surplus that can then go towards some of the bigger long-term projects. You know, thinking of things like the long-awaited need to restore Ashton Court Mansion, for example, so we can use this to actually supercharge a commercial income and continue this virtuous circle. And it would be great if we can use this task and finish group, as outlined in the papers, to get a better understanding of why several new events have recently sadly had the council in Bristol, and what investments we can make to attract the right scale of festivals and events to the city. So I'm really glad that some of our members who have experience of the live event sector themselves have expressed an interest in joining this group, and I hope that we can get some representations from the live event sector to the group. And I also want to assure the public a bit about what the group isn't. It's not about blatant over-commercialisation. We're not suddenly going to be turning our green spaces into Universal Studios theme park or something like that. And I also want to address, seeing as Francis and Len have waited so patiently today on to address some of your questions from this morning. So we'll absolutely find a way to involve the Parks Forum in the group and make representations. Realistically, we're not talking about introducing events at all 430 of our parks. We wouldn't have the capacity to do that in the first place anyway. But the very idea is to provide funding that can then be reinvested across our parks and estates, not just those that happen to be capable of hosting events because of where they are, their size, etc. So I'm really hopeful that the group can make some ambitious recommendations. I'm looking forward to playing my part in that we can bring out the creativity of members, and that we can use that to deliver exciting activities for all Bristolians and visitors to our parks and open spaces. Thank you.
Patsy?
I just wanted to respond to a comment made from the gallery earlier on, just to reassure that all the money we're raising in parks does go into parks, and we don't ring fence it. So if we make the money at Ashton Court, it's not ring fence for Ashton Court, it's put into the park service and spent across the city.
Yeah, and I'd like to make the general point as well that we've called this commercialization, and there is an objective for looking at opportunities to raise more money, both from our physical estate and from our events as well. It's also about improving the experience of people who use our parks. Some parks have cafes, some don't. Some have a caravan that moves in and out. Some have a fixed cafe. Some have really good interpretation on site to enhance the experience, like St Andrews Park does, my local park. Some don't, but we also want to make, as far as we can, our festivals to be green and sustainable. And that's going to require some investment in electrics, in the amphitheatre, up on the downs, and so on. I think that would be really good for Bristol, if we can crack that, if we can make Bristol Britain's and perhaps Europe's greenest city, in the small G sense, for festivals and events and the visitor experience in general. So I think this group is about more than looking at opportunities to maximise our revenue. If we get it right, I think lots of good things could come out of it. Any other points from colleagues? Avalon?
I'll just make the one about cultural events. I'm usually in touch with Steve Hunt when we do something on St Mark's Road or around those areas, but when it comes to the parks, and especially things like Eid, we have the big Eid festivals and stuff like that, they're more cultural than commercial, of course. Can I have some reassurances about the protection of those type of cultural events and the opportunities that, you know, that they can continue rather than all be commercialized and very expensive to get up and running?
Hi everyone. Yes, we have a commitment for our community and cultural events. We have that commitment to make sure that some of the commercial events that generate the more income can obviously go back into the parks and help the community events. Unfortunately, there are fees attached to all the events because of officer time, and we have to make some money for the parks, but we are looking at a fee structure for 27, and there is some work around different spaces and different cultural organisations. At the moment there is a discount for communities, which we're really happy to uphold, and we make sure that we benchmark that alongside other local authorities.
I think one of the things we might usefully look at, I mean, we've got our terms of reference here, but the committee will be all organic, is about where there are gaps in our events programme, particularly where there are cultural gaps that may not be addressed at the moment or used to be. In the past, I remember going to the Bristol Islamic Festival for several years in Eastville Park, which was a huge occasion, where there are other groups might want to have similar events, and how we can help them achieve that would be a good objective of the group as well. If there are no other points, I'll turn to the recommendations. I'm going to take them sequentially. First of all, I'd like us to approve the terms of reference. So recommendation 1 is that the Committee for Public Health and Communities report and approves the recommended approach in the terms of reference for the commercialisation task and finish group. So can I propose that first, and can I have a seconder? Councillor McAllister, thank you. Can we indicate we're in favour of that? I assume we all will be. Thank you. So that's 9 in favour of that. The reason I'm doing it sequentially is because there are things to sort out in recommendation 2. I was hoping we would have all the names for the members of this task and finish group by today, but we haven't quite achieved that. So I want to leave open the flexibility about whether it's a 7-member committee or a 9-member committee. However, we do know some names and indications of interest. Ordinarily, I could have chaired this group, but in terms of spreading the love, I've had a good conversation with Councillor Fraser, and I'm going to put into this recommendation that Ed is chair of this group. So can I move recommendation 2, that the Committee for Public Health and Communities agrees the chair, Councillor Ed Fraser, and the membership to be politically proportionate to the membership of full council, in the first instance for a 7-member group, but for us to have the flexibility, if more names come forward, by the time of the first meeting, so I don't think we want to add during the year, for it to be a full 9-member group. Hope that's clear. Can somebody second that? Thank you, Tom. We're all in favour of both Ed being chair and it being either 7 or 9. Thank you. And hopefully the next two are uncontroversial. Thirdly, that the Committee for Public Health and Communities delegates the decision to agree frequency of the meetings of the Task and Finish group to that group at its first meeting or beforehand if it wishes to do so. So I propose that. Can I have a seconder? Councillor Fraser, the chair of the group, can I second that? And we're all in favour? Thank you. And fourthly, that the Task and Finish group returns to this committee at our scheduled meeting in November with its findings. If we find that there is a really rich discussion and there are lots of things to consider, we can, of course, amend this at a subsequent meeting of this committee. But for now, I am keen on the word finish in Task and Finish groups. There are quite a lot of them proliferating across the council at the moment, and I know that puts pressure on members. So I'm proposing that this comes back in November. I propose that. Councillor Fraser seconds. Those in favour indicate. Thank you. That's all 9 of us. So that's all of those with a slight tweak to recommendation 2 passed. So thank you very much. Thank you to Richard, Greg and Harriet. And if Kate, Head of Libraries, now comes to the front for item 12. Right, so we now turn to our final item today, agenda item 12, which is to set up another Task and Finish group, and this is to agree a strategy for the city's libraries service. The terms of reference for this group are set out in the annex at pages 176 to 177 in our report, and it's important, I'm just going to say this on the record, members and officers all know this, but for people who are listening and who might have thoughts about what this group is going to do, This group is specifically been set up to look at how we can modernise our library service, how we can make it fit for purpose for at least the next 5 years. It is specifically not a committee that's going to consider the budget of the library service or the physical offer of the library service in terms of the buildings from which it is delivered. What it's going to do is come together and design what we think the library service should look like, report back to this committee, as will the other Task and Finish group in November. Then we'll have a discussion about what the implications of those discussions and recommendations might be. And the officers will go away and design a service offer, which we'll have to consider at this full committee sometime next year. So I'm just trying to set out there what the parameters are for this Task and Finish group. It is not to consider the future of the library's buildings. It is simply to design what we think a modern fit-for-purpose libraries service should be. But to put that better than I did, we've now got the heads of libraries, Kate Murray, who will introduce the report, and then we can have a discussion.
Thank you. Hello, I'm Kate Murray. I'm Head of Libraries. So this is a paper to initiate a cross-party Task and Finish group on the library strategy. There are 2 papers with the second detailing the scope of the group. The previous library strategy ran from 2020 to 2024, and it followed the themes of the then corporate strategy, which of course has changed and will change again in May. It is proposed that we consider a new strategy for a period of 4 to 5 years, and it will set the strategic direction of the service and the offer to Bristol residents and those who use and may use the library service. The library service is statutory, and there are 26 libraries with a community organisation in Lockleys providing some access to library services. The work of the Task and Finish group will acknowledge the changes in the city, the areas of development and growth, the work with partners, the changing use of libraries, and any new areas of need. The Council will, as I mentioned, will have a new corporate strategy from mid-May, and this is an important framework in which to consider a new service strategy. The Task and Finish group will be informed by work on a needs assessment, where data in the Council will be collected and analysed and used to identify the needs of residents in the city and any gaps in provision and also opportunities. The scope of the Task and Finish group is proposed in Appendix A. This will build on work that we completed in the previous strategy and any feedback post-2020. It'll give us an opportunity to discuss and explore what a good and sustainable library service for Bristol looks like and establish some key principles for a new strategy within that statutory framework. Thank you.
Short and sweet. Contributions from colleagues? Patrick? Tom?
Thank you, Chair. I think it's good that we've got this Task and Finish group to go away and do the work of coming up with what this library service needs to look like. I think we all know that something does need to happen with the library service. Omnipresent funding issues across the whole council. Libraries aren't immune to those, and the previous administration would salami slice them in effect to keep everything open. But now there's a lot of, to repeat a phrase I used during the budget process, zombie libraries in effect. They're technically still open. A lot of them are understaffed, hours are limited, several are open 3 days a week, often only during working hours. I noticed the Hartcliffe Library is open for a mere 16 hours a week. That's in one of the most deprived areas in the city. And if we've got those areas, people learn, sadly, they can't rely on their library service because it's not open when they need it. That drives down demand, drives down use further. It's a vicious circle. I did note South Gloucestershire's libraries are all open 80 hours a week, 80, which is I think that's a library service that people will learn to rely on. But I think a library that's not used because people can't rely on this is by definition not fulfilling the purpose of a library. It's not being a good use of resources. So it's great that we've got this piece of work to say, okay, how can we make this service work for the people of Bristol better than it is currently? In the context of continued government austerity, unfortunately, I do wonder, actually, that there's a point about student accommodation in here as part of the pressures on libraries. We should try and see if we can get sponsorship from the universities for the libraries. They rely on these services, they benefit from them, it's a public good. They've got their own funding pressures, of course, but they've also got a lot of disposable income. We should see if we can try and, as a more positive step, maybe get some more money from them. But overall, I'd like to thank the officers for preparing this report so that we councillors or whoever's on it can go away and do the hard work of figuring out how can we best serve the people of Bristol, because right now we're not serving the people of Bristol well, unfortunately.
Thank you. Tell me if you want to. I'll take Tom. You can perhaps deal with both.
So I recognise some of what Councillor McAllister is saying, but I think we disagree very strongly on the cure. And I would say that one of the things that would serve particularly the most deprived areas of Bristol least is if their libraries were permanently closed. So I recognise that there was a strategy or a proposal that was brought to the last administration, which was quite rightly rejected in my view, which would have led to library closures. I was curious to know what foundation this new strategy we're working from. Would we be using those old proposals as a base point, or would we be coming up with something completely new?
Well, I'll answer that first, and I'll ask the officers to comment. We're all aware of what has happened in the past, or what did not happen, as you've alluded to, Tom. Patrick and I think both campaigned in a by-election in February 2023 against the closure of the Central Library, which was a very live proposal by the former mayor. And probably because that by-election was taking place, it was withdrawn in a panic. But nonetheless, I know it was very worked up as a plan to close our iconic Central Library. And this administration, it was one of the first things we made clear 11 months ago. That is dead on arrival. The Central Library is safe and it is not moving from its current location. We also know that while the physical network of library buildings, none of them closed, under the previous administration, there were huge cuts to the budget, the staffing budget, which meant, as Councillor McAllister has said, meant that they're only open for very limited hours indeed. And Avonmouth Library in your ward, Tom, does have very limited hours, which, as Patrick was saying, obviously reflects on footfall through the doors. If they're not open, people can't walk through them. So we know where we're starting from, but if this group is going to work on a cross-party basis, then we will have to leave that behind us and start afresh and think, what do we want our library service to look like in a couple of years' time, realistically, and to be open-minded about it and not dwell too much on what has happened in the past. We've got budget protection for 2 years as a result of decisions made by this administration. And that gives us time and space to redesign a service. Because if we are honest, I wouldn't use the phrase Patrick used, but it doesn't serve the people of Bristol well. If you look at the distribution of visitors, they do vary enormously in between its Bishopston Library, which happens to be my local library where I live, and Henley's Library where I represent, but also Bedminster Library are the top 3 visited libraries with over 70,000 visits a year. I think Avonmouth is down in the very low thousands indeed, are some other libraries. We need to unpick that and think, how can we have a library service that whether people live in Shirehampton or whether they live in Westbury Park or whether they live in Hotwells or Stapleton, know that there is a library service for them out there that they can use. And it may be delivered in a different way. Library buildings are some of the physical assets that the city has, but the city has lots of other physical assets and services as well. So we need to think flexibly about how we can get the most for our money and deliver the best possible service for the public. So I would make a plea to everyone who's going to be on this group to be open-minded. We're going to have our discussions privately in a safe space, so we can be robust with each other if we want, but that only gets us so far. Ultimately, we're all committed to having the best possible library service for the city. One final point I want to make about how I want this group to work is also I wanted to not just be a safe place for councillors to discuss difficult issues, but also for the public. There are lots of friends of library groups across the city to come to us with their views as well. So we will have at least one public open sort of evidence session for people to come and make representations. Because there is a lot of passion out there, not just political passion, but there is real passion about people wanting to use their libraries, both for their actual purpose, their statutory purpose, but also for the much wider purpose that many of them had. I went on a visit to Clifton Library with Councillor O'Rourke Tuesday morning this week, and it was actually on a day that it's closed as a library, but it is open as a community resource. So there was a knitting and tapestry class going on there, which had some people who have learning impairments taking part. There was a bridge club, a very Clifton thing, I'm sure, taking place. But much to my surprise, and I never thought I would see this in a library, the whole of the upstairs room was a table tennis session for older, lonely men. So libraries can do a lot of good things, and that's what I want this group to focus on as an important community resource. How can we get the best out of them? But we have to be open-minded to make it work. Tom.
So, I will attempt to be collegious about this, and I apologise if at any point I fail. But accepting that there is a need not perhaps to live in the past, and accepting that you have made comments very recently, such as right now, in fact, around Avonmouth Library in particular, and indeed I am quite worried about its future if it is not properly considered. I know we've had a discussion on metrics and how we should be assessing these. You've just mentioned how valuable Clifton Library is as a community asset, and I think the same is very much true for areas like Avonmouth, Shirehampton, Stockwood perhaps, if you want the exact other end of the city. There are lots of places which are highly deprived and which need these libraries as a resource. And to be blunt, I know that the administration voted to defer on that library funding cut, but it was over, I believe it was over 50%. That is not plausible. And there's been mentioned in terms of South Gloucestershire in terms of use, perhaps, and I mean, the library budget is less than 1% of what we're talking about here. Perhaps it would be wiser to be more courageous about this, to look at South Gloucestershire as an example and say, what can we actually do to build up use? What can we do to make this better? I'm very happy to have those kinds of conversations, and I will be open-minded in how we achieve that. I think the sponsorship by the university is a good point. There might be other sponsorships. I'm thinking for the port in Avonmouth, there might be options there. I'm open to having discussions around this. What I am not open to is taking valuable community assets away from communities that have already had far too much taken away from them. I recognise the circumstances we're in nationally and locally, but I don't think that is something that we should be doing as ostensibly progressive parties, with one exception.
Thank you, Chair. Very quickly, Councillor Blenkinsop said earlier that he disagreed with me on cure. I just want to be clear, I haven't proposed any sort of cure or remedy or anything. I'm not trying to prejudge the workings of a cross-party task and finish group. I wouldn't attempt to do so. That is work that has to happen. I'm simply praising the fact we've set up the task and finish group to do that work in that hopefully collegiate cross-party manner.
From the officers, we've
just wanted to apologise briefly if I misinterpreted his remarks.
So I'd just like to reassure the committee that the starting point is the starting point. It's where we're at. There's no pre-work, there's no lists, there's no savings targets, there's no budgetary cuts planned. This is about the strategy is run out. We haven't got a live strategy for the service. This is the opportunity for the committee to guide the service and determine what does good look like. I will, remind the committee that in the terms of reference, the looking at buildings is totally out of scope. This is not a savings exercise. This is about for a real opportunity for committee members to tell us as officers what they want to see delivered, what your opinion is of a good service. In parallel to that, we will also be engaging with focus groups and friends of groups to hear their views. And it's our job as officers to go away and look at how we present that back to you and say, this is what we can do. I mean, I do agree that it is a real shame that we have, 27 buildings that are closed, far more than they're open. But the service was, while the previous administration didn't go ahead with closures, they did cut the budget by 25%. So that did cut our opening times by 25%. 90% of our costs are staffing costs. So that meant 25% loss to staff. So it was a real cut. So we do need to look at a blank page. How do we build this up into a service that we're all really proud of? No librarian wants to work in a library that is closed more than it's open. So I think there is a real opportunity for all of us officers, focus groups, friends of groups and committee members to give us a steer on what you would like to see delivered. And there is no predetermination. I cannot reassure you enough. This is about a strategy. This is about tell us what you want us to deliver.
Okay, and South Gloucestershire was mentioned. I'm sure we'll look at lots of different models that take place in different parts of the country, some of which I've seen in our core city. Sort of family of local authorities have approached this as well is going to be quite informative. Right, if there are no other comments, sorry, Lisa.
So I'd like to table our amendment. So I do that now.
Okay. Just coming to that. Right, as with the last task and finish group, I'm going to work through these sequentially. So first of all, recommendation 1. I've had indication that there may be an amendment to recommendation 1. Do you want to move that now, Lisa?
Yes, and also...
Sorry. I'm being nudged by the clerk. I probably... Right. That's why he's here. I'll move recommendation 1, first of all, that the Committee for Public Health and Communities notes the report and approves the recommended approach and scope in the terms of reference in Appendix A for the Library Strategy Task and Finish Group. So I move that as the recommendation that's in front of us. Can I have a seconder, please? One of you? Councillor Malik. So that is moved and seconded, but I understand that there may be an amendment. Lisa.
Yes, thank you. So we would, after the recommendation that the Committee for Public Health and Communities note the report and approves the recommended approach and scope in the terms of reference, Appendix A, for the Library Strategy Task and Finish Group, insert, noting that recommending the closure of libraries and/or a reduction in the service budget is outside the scope of this task and finish group and is not supported by the committee. And then to Annex 1 in the terms of reference, to understand how to offer a universal service as well as targeted provision, insert, whilst avoiding the permanent closure of any libraries, keeping all 26 existing libraries and the community organisation-led access point in Lockleys open. And I can talk you through why we're submitting this amendment, if you'd like. Okay.
Do you have a seconder for that? Councillor Blenkinsop. Right, just so I am clear, because I can't see that screen, you are proposing, first of all, an amendment to recommendation 1, but you're also proposing an amendment to the text of the terms of reference, in particular line 7, which currently says to understand how to offer a universal service as well as targeted provision. And while noting in your amendment to point 1 of the recommendations, it's got 2 aspects to that. One is noting that a reduction or closure is outside the scope of this task and finish group, which is the understanding. You've heard me say that very clearly, so that's a fact. But you're also saying, and is not supported by the committee, which I think are 2 separate points, and that is basically a prejudgment of what the group might want to recommend. Can I just ask you, just to help us all out, whether you'd consider separating those 2 points? Because I think on the first point of that sentence, everyone's going to agree with it. It's just a statement of fact. But the second point is possibly something we'd want to divide on. Are you able to do that?
I think not, because as far as we're concerned, if the closure of libraries is outside of the scope, and this group will not produce work that could inform the closure of libraries, then we would like to clarify that that is not going to be supported as part of this committee's work.
Yeah, I think it's a semantic difficulty. I can see what you're trying to do, but it is a difficulty. There are two aspects to that amendment, and I know this is a classic manoeuvre. All parties will have done this in Parliament. You put up something that has agreement in it, but something where there isn't agreement, then you vote down the whole thing, and that's what you get stung for. But we are all agreed that the scope of this group is not to look at any sort of hit list at all. All of us agree that. But the second part of that sentence is a severe curtailment of the free thinking that the group might need to do. And that's why I'm just asking you if you could separate them out, then it's a clearer vote of what the committee actually feels rather than people misinterpreting what the committee feels.
So,
but it's your amendment. It's up to you.
Yeah, I mean, we want to be really clear that we do not support the closure of any libraries, and that if the closures are actually out of scope, then voting for an amendment to give public clarity, because this has been in the public domain. There's been a lot of discussion around that. There's been a lot of statements issued on the closure of libraries. Stephen yourself said that one of the objectives of this task and finish group will to craft a service that is financially sustainable. So people are going to be aware of the context around this task and finish group, and we just think for clarity for the public who may have concerns about the outcomes of this group, that it would be really good to commit to keeping all 26 libraries open.
Right, I'm going to take Councillor Fraser. I don't know if Ada, you want to say anything, but I'll take Councillor Fraser, and then if you don't, I'll ask the officers to comment.
I've got to be honest, I think moving this amendment at 11:30 in the middle of the meeting feels very performative. I think this is being done to create some kind of dividing line in the media, maybe as a precursor to some kind of press release or a petition, perhaps. I don't think we should actually be dignifying this with further discussion. I think we should be moving to a vote, and I'll be voting against this proposal because it's against the spirit of task and finish groups to try and pigeonhole their ability to discuss issues in that way. I won't be supporting it.
As you said, I'll take one final point, but then I want the officers to comment.
That's very fair. I would point out this was submitted before the meeting. It was not submitted right now. Thank you. It was submitted before the meeting, Ed, and I want that on the record. We can disagree on that.
Okay.
Can I make a second point?
Stop, but you can make your second point.
Which is that there are a lot of people who have quite genuine concerns, and I think the Task and Finish Group will have quite genuine concerns around the intentions of this administration, considering the initial proposals that were deferred when it comes to the library budgets. If you want to state quite publicly, Ed, and I would very much welcome this, that you and the Green Party have no plans to close any of these libraries, we'd welcome that. But I don't think you will.
I'm not going to invite him to do that because he can't speak for the whole of his group any more than I can or you can. But I will correct you on something. There were no proposals brought forward as part of the budget process for the closure of libraries. There were options across a whole range of services, both for this committee and other committees, that officers rightly prepared, given the budget context of over £50 million worth of savings we had to find. And those options were considered in public by the Finance Subcommittee, which Councillor Malik was chairing at the time. And I'm sure he will recall, if others don't, that I made it as clear as I could that they were options which I did not personally support, and my group didn't, and his group didn't either. But they were brought to us as part of the budget preparation process, and we could have just considered them in private and ditched them, but we actually aired them. But they were never proposals, they were options. So we now start from a clean slate, and speaking of that clean slate, I'd like the director, Patsy Miller, to...
So
just going back to what I said earlier, I think this is an opportunity for a clean slate, for, you know, some really good thinking from focus groups and from members to drive a new service that people are proud of and can access. And I think the residents would be really concerned if we said that we were setting up a task and finish group to develop a new strategy, but that strategy was already predetermined because we've already said that we're going to keep 26 libraries, which means that they are going to continue to be closed more than they're open. And I think that severely restricts both residents' input who might want to do something different. We have community groups, as the chair's just pointed out, we have communities running libraries, services within libraries. And to actually start this process with a predetermination that we're not going to change anything, we're going to stay shut more than we're open, I think residents would lose faith in our ability to come forward with really transformative ideas and make any sort of change, because we're telling them, tell us what you want us to deliver, but don't tell us that you want us to be open more often or you want extended access, because we can't have we can't have budget increases. So I just think residents would be really disappointed if we really curtailed the scope of the task and finish group.
Right. Okay. We've had an airing. The recommendation has been moved and seconded, but we have an amendment that's been validly moved and seconded. So we need to take a vote on the amendment first. For clarity, Ian, can you read out the amendment as you've got in front of you?
Yes. So just to be clear, the amendment is also shown on the screen in the public gallery. So the amendment is to amend recommendation 1. The first part of it is recommendation 1, that the Committee for Public Health and Communities notes the report and approves the recommended approach and scope in the terms of reference, Appendix A, for the Library Strategy Task and Finish Group. And then it's to add this new wording, noting that recommending the closure of libraries and or a reduction in the service budget is outside the scope of this task and finish group and is not supported by the committee. And the second part of the amendment is to amend Annex 1, Terms of Reference, point 7, to understand how to offer a universal service as well as targeted provision, and then to add the following wording, whilst avoiding the permanent closure of any libraries, keeping all 26 existing libraries and the community organisation-led access point in Lochleys open.
Right. So for clarity, that's the amendment that has been proposed by Councillor Durston and seconded by Councillor Blenkinsop. So we'll vote on that first. So those who are in favour of the Labour amendments, please indicate. Thank you. Those who are against that amendment? Right, so that amendment is defeated by 6 votes to 3. I said I would move through these sequentially, so we now move to a vote on the unamended first recommendation, that the Committee for Public Health and Communities notes the report and approves the recommended approach and scope in the terms of reference as set out in Appendix A for the Libraries Strategy Task and Finish Group. I'd already moved that. Councillor Malik seconded. So can we have a vote for recommendation 1 as tabled and unamended? Thank you. Those against recommendation 1? Okay, well, recommendation 1 is passed by 6 votes to 3. Councillor Durston, Blenkinsop and Johnson voted against. The second recommendation, so if I can propose this, please, that the Committee for Public Health and Communities agrees, the Chair. My name is in the appendix, because that was reasonably certain, unlike the previous task and finish group. Approves the Chair, Stephen Williams, and the membership of the task and finish group to fully represent the political balance of the Council. So this will be a 9-member committee. I'm sure there'll be no doubt as there'll be plenty of people interested in serving on it. So I propose that. Are you seconding? Councillor Blenkinsop seconds. All those in favour, please indicate. Thank you very much. That is unanimous. That means the group can go ahead with me as chair. And if I could just make a plea to colleagues from other parties to get the names into Democratic Services as soon as possible, so the group can start work realistically from early June onwards. Third recommendation, not quite done, that the Committee for Public Health and Communities delegate the decision to agree the frequency and duration of the meetings to the members of the Task and Finish group themselves. So I propose that. Can I have a seconder? Councillor Fraser. Thank you. All those in favour? Thank you very much. That's all 9 of us. And finally, recommendation for that the Task and Finish group returns to this committee at our scheduled meeting in November with its findings, when no doubt we'll have an even feistier exchange. Those in favour? Thank you very much.
Seconded before the vote.
Oh, sorry. Councillor Fraser is seconded. Thank you very much. Yeah, he's seconded now, so that's fine. Can we have a vote again on option recommendation 4 as properly proposed and seconded? Thank you very much. So that means both the Task and Finish groups are now agreed with their terms of reference, with myself chairing the Libraries group and Councillor Fraser chairing the Parks and Events Commercialization group. Thank you very much for everyone's attendance today, and do enjoy your lunches.